Hey, Jeremy, I think we're ready if you are.
Sure, let's go for it.
Okay, good afternoon. I'm Aaron Yao. I'm the designated federal officer for the Clean Air Scientific Advisory Committee. In my role as DFO, I'd like to formally open this public meeting. The CASAC is an independent expert federal advisory committee chartered under the authority of the Federal Advisory Committee Act. The CASAC is empowered under the Clean Air Act to provide independent advice to the EPA administrator on the scientific and technical bases for EPA's national ambient air quality standards. FACA and EPA policy require that CASAC meetings be announced to the public in the Federal Register and that substantive deliberations and interactions with EPA and the public be conducted in open sessions where DFO is present to ensure that the requirements of FACA are met. FACA also requires that public meetings provide an opportunity for public comment. There is a public comment period noted on the agenda where members of the public have registered in advance to make oral comments. Written comments have also been received and have been sent to the panel members and posted on the meeting webpage. Minutes will be prepared to summarize discussions and action items in accordance with the requirements of FACA. I will work with the chair to certify the minutes and have them posted on the CASAC website. The CASAC consists of special government employees appointed by the EPA to their positions. As government employees, the members are subject to all applicable ethics laws and implementing regulations. The SAD staff office has determined that advisors participating in this meeting have no financial conflicts of interest or appearance of a loss of impartiality relating to the topic of this meeting. I would now like to turn the meeting over to Mr. Tom Brennan, Director of the SAB Staff Office, and then over to Dr. Jeremy Sarnett, Chair of the CASAC.
Thank you, Aaron, and welcome everyone to this public meeting of the CASAC-led panel. Today's the first meeting for two new chartered CASAC members, although they both served on previous panels. Today, Dr. Jeremy Sarnett leads his first meeting as CASAC chair, and Dr. Jennifer Peel joins as a chartered member. And I thank you both for stepping into these leadership roles. I also want to recognize two former chartered CASAC members who just timed off, but are continuing on this panel now, Dr. Shepard and Chow. Thank you both for your continued service. So those were the changes, but some things don't change. For instance, our DFO, Aaron Yao, his excellent work during all the changes that happen in a yearly basis has really kept the CASAC grounded and moving forward. And Aaron, you do your job so well that things go very smoothly, and thank you for all you do. I'd also like to thank the members of the public who have written in and shared comments and are speaking today. Public participation is just a hallmark of this process, and I thank you for those who are participating and taking this opportunity to share your thoughts with this panel. I'd also like to thank members of EPA, my colleagues, and Office of Air for developing the content that we'll be going over today. We all know how much work it takes to lead up to one of these meetings, and the hours and hours that they put into it are much appreciated by us all, so thank you for that. And with that, I'd like to pass it over to our chair, Dr. Sarnett.
Hey, hi everybody. Good afternoon and good morning. Well, this is, I don't know if I would have actually planned to kind of come into a process like this right in the middle of where we are right now, but I assure you that I've been working hard to catch up to where this panel has been, and just so that we know that we're on the same page in terms of the process. So as everybody should know, this is a second consultation meeting to discuss aspects of the IRP specifically related to a couple components of the REA modeling process. And the last time that you guys met to discuss these issues actually was June 2023. So it's been a while. And then in August of 2023, this panel also convened to discuss the ISA. So that's where we are, and I do want to kind of get to a exciting conversation on Thiessen polygons, among other things. But we're going to do some introductions first, and then I'll go over just the rest of the substantive agenda and had a kind of couple of broader comments about what we're doing today. So I'll just introduce myself. I know many of you, and and a bunch of you I haven't met yet. I'm Jeremy Sarnat. I'm at Emory University. I've been here for quite a while, almost 20 years. And I do air pollution exposure and epidemiology work. A lot of my work looks at how aspects of exposure science inform environmental epidemiology. As Tom mentioned, I've never been on chartered CASAC previously, but I have served on a number of panels over the years. I've always found them to be among the most important work that I've done. I'm sure you guys feel the same as well. Just that really addressing the translational side to a lot of the science that we do. So I'm excited to be involved in the process as a chartered member and as chair, and have learned a lot already from your comments and from everything that's been done on this panel. So I want to jump into it, and we'll go over the agenda after we do the introductions. So first, I'm gonna ask Jen Peel, the other chartered member of CASAC, to introduce herself, and then I will let the other panel members also briefly introduce themselves as well.
Good morning, good afternoon. I'm Jennifer Peel. I'm a professor of epidemiology at Colorado State University in the Colorado School of Public Health, and I'm an environmental epidemiologist, and I have served on the PM and ozone panels in the past, and I'm thrilled to be here. Thanks.
Jen, and we'll just go in alphabetical order here. So George Allen.
Hey, good morning and afternoon, everybody. George Allen. I'm the chief scientist at NESCOM out in Boston, and my expertise is in measurement methods, exposure assessment, and a little bit of atmospheric chemistry.
Thanks, George. Jim Boylan.
Hello, everyone. Jim Boylan. I am chief of the Air Protection Branch at the Georgia Environmental Protection Division. I am a former chartered CASAC member and have expertise in emissions, modeling, measurements, and control strategy development. Thank you.
Thank you. Judy Chow.
Hi, everybody. I'm Judy Chow. I'm research professor in the Division of Atmospheric Sciences of DESA Research Institute, part of the Nevada System of Higher Education. My research interests have been in ambient source measurement, data analysis, and modeling. Thank you.
Okay. Deborah Corey Schlechter.
Hi, I'm Deborah Corey Schlecht. I'm professor of environmental medicine at the University of Rochester Medical Center, and my area of expertise is in air pollution in the brain, both in terms of brain development and neurodegenerative diseases and disorders.
Thank you, Deborah. Philip Goodrum.
Hi, everybody. Phil Goodrum here. I'm a principal toxicologist at GSI Environmental. My research areas are the use of environmental models in risk assessment and the application of principles of toxicology and exposure assessment.
Thanks, Phil. Perry Gottsfeld.
Yes, Perry Gottesfeld, the Executive Director of Occupational Knowledge.
Perry, can you turn up your volume? I think we're having problems hearing you.
Could you hear me now?
Better.
Okay, sorry. I'm the Executive Director of Occupational Knowledge International, a nonprofit based in San Francisco. My expertise is around the exposure assessment of lead, and I've been working on lead poisoning prevention for more than 30 years.
Thank you. Davin Henze.
Hi, everyone. My name is Davin Henze. I'm a professor of mechanical engineering and environmental engineering at CU Boulder. My background is in air pollution modeling. I have been / am on / will be on other CASAC panels like the SOx, NOx secondary standards and ozone.
Thank you. And I'll just make note that Howard, who is an ad hoc member of this panel, unfortunately can't make it today. Chris Johnson.
Hi, I'm Chris Johnson. I'm professor of civil and environmental engineering at Syracuse University. I've been involved in this process in one way or another for about 20 years, and my expertise is in the areas of soil science and terrestrial ecosystems.
Thanks, Chris. Susan Corrick.
Hi, good morning, good afternoon. I'm a physician epidemiologist at the Harvard T.H. Chan School of Public Health and Brigham and Women's Hospital in Boston. And my area of expertise is largely focused on environmental determinants of children's health, particularly neurodevelopmental health outcomes.
Thank you. Bruce Lanphier.
Good morning, Bruce Lanphier, Simon Fraser University, and Bowen Island and the Salish Sea. And I study childhood lead poisoning, sources of lead exposure, and more recently, heart disease in adults with lead poisoning.
Thank you. Joel Pounds. Joel, are you here? Oh, Joel, you're up there, yeah.
Yeah, good afternoon. Can you hear me? Yeah. I'm Joel Pounds. I've served on this panel before for several rounds. I'm a toxicologist, retired as laboratory fellow emeritus from the Pacific Northwest National Laboratory. Done metal toxicology and nanotoxicology, including biokinetic models.
Great, thank you. Brian Schwartz.
Hello, Brian Schwartz. I am a professor of environmental health and engineering at the Johns Hopkins Bloomberg School of Public Health. I am a physician and epidemiologist, and I have mostly done studies of the health effects of lead in adults.
You, Leanne Shepard.
Yeah, hi everyone. I'm Leanne Shepard. I'm a professor of both biostatistics and environmental and occupational health sciences at the University of Washington, and also currently interim chair of environmental occupational health sciences. And my research areas are on measuring and modeling exposure and the implications for understanding and estimating the health effects.
Thanks, Leanne. William Stubblefield.
Yeah, good morning. It's good to see everybody, even though we're not in the same room. But anyway, I'm Bill Stubblefield. I'm a professor of environmental toxicology in the Department of Molecular and Environmental Toxicology at Oregon State University. My area of expertise is metals toxicology and metals bioavailability and risk assessment. And I have been involved with this panel since roughly 2010, or somewhere in that range. So I think Chris, you and I have been on it for quite a while together. So,
thank you, Brisa Sanchez.
Hi, good afternoon, everybody. I'm Brisa Sanchez. I'm a professor of biostatistics at Drexel University, Dornsife School of Public Health. My area of expertise is environmental statistics, methods and applications to evaluate health effects.
Thank you. Kathleen Fork.
Hi, I'm Kathleen Bork. I'm a recently retired staff toxicologist at California EPA Office of Environmental Health Hazard Assessment. And my area of expertise is in PBPK modeling and exposure analysis.
Thanks, Kathleen. And finally, Mark Weiskopf.
Yes, hi. I'm a professor of environmental epidemiology at the Harvard School of Public Health in the Department of Environmental Health and Epidemiology. My background is in neuroscience and epidemiology, and I focus on environmental factors, lead being a big one, and neurological outcomes, as well as causal inference issues in environmental health.
Hey, I think I have everybody, but if there's somebody that I forgot to introduce from the panel, speak now. Okay, great. So you received the agenda, and today we're going to continue to consult with EPA staff on mainly two specific aspects of their proposed REA plan, as well as the charge questions that were circulated to us on those questions. They deal with aspects of the case study design, as well as some of the dust lead modeling approaches and assumptions. I think the charge was fairly clear. Their there might be a couple of ancillary issues as well that are associated with aspects of the charge that we may want to take up if we have time. I think we will have time based on the comments that we've received, but I really want this to be a meaningful discussion and one that's helpful to EPA so that they can move forward with the rest of this process and conduct the REA and the policy assessment and so forth. So before we start with the public comments and then open it up to a panel discussion from individual panel members, I'm going to turn it over to our colleagues at EPA. Karen, I think maybe you're you're going to lead off here, and you're going to kind of go through a little bit some of the details of the specific issues that you asked for this meeting to be conducted. So I'll turn it over to you guys, and then we'll do public comments.
Thank you, Dr. Sarnett. So we'll start going through the slides. So as Dr. Sarnett said, we're here today to give you an update and to discuss two key design elements of the human health risk assessment for the lead NACs.
And Karen, I'm just going to interrupt you for a second and just make a note to the rest of the panel as well, is that let's limit any further interruptions to clarifying questions on any of the slides. And keep in mind that we're going to have hopefully plenty of time to discuss a lot of the comments that you raised in your individual discussion points. But for questions that require some clarification, Karen, you're okay with us asking?
Yes, of course. And I think I'm going to share this presentation with two others. So if you flip to the next slide, I can give some introductions. And our plan is given that it's two key elements, our plan is to go through the first element and then to pause, and then we can, take some questions and clarifying, comments, et cetera. And then we can go through the second element and do the same. So since they're so separate, I think that might be the best approach to give, people the time to focus on one and then the other with respect to their questions. Again, my name is Karen Wesson. I am the group leader of the Ambient Standards Group here at EPA. Today, the presentation that follows will be given by Deidre Murphy and Zach Picard. So Deidre Murphy is the staff lead for the NACS review here at EPA, and Zach Picard is the staff lead for the exposure and risk analyses for the lead review on the health side. I also wanted to mention we are joined by some of our other colleagues that you may also hear from. Bob Whalen is the group leader of the Risk and Benefits Group. And then we also have our colleagues at OGC, Haley Kerr and David Orland. And then I also want to mention that we're joined today by some of our colleagues in the Office of Research and Development. And so if there are questions or issues, they can also assist and help in the discussion. And with that, let me hand it off to Deidre Murphy.
Deidre, I'm not sure if you're speaking, but we can't hear you. Is it just me, or can anyone hear? No.
She's muted. So
she's muted. Yeah.
Sorry. Okay, Deidre, you're muted.
It looks like she's trying to get something set up.
Okay.
What would a virtual meeting be without a little bit of, IT hiccup?
Let's give it another couple seconds, and then Karen is do you want to try to pinch hit, or is there somebody on the team that could take Deidre's slides, or if she can't connect to it?
Well, I can definitely do the outline, but I think after that we need Zach Picar's expertise for the slides. So is there a way, Zach, that you can connect if Deidre cannot?
Jeremy, maybe we can do public comments and then come back, give Deirdre and Zach some time to figure this out.
Okay, let's to save time, why don't we do the public comments? Aaron, do you want to introduce the relatively short roster of commenters?
So today we just have one public commenter, Mickey Barnes with Oregon Aviation Watch. Mickey, are you ready to speak?
Yes, I am. Can you hear me?
We can. Here, hold on. Let me spotlight you. Okay, so you'll have 5 minutes to give your oral statements, and I'll let you know when your 5 minutes are up.
Thank you. So I want to thank the chair and the CASAC lead panel for allowing me to offer my comments. Since 2008, when the NACs for lead were last lowered, multiple studies involving more than 500 airports and over 1 million blood lead level screenings provide evidence that children living near airports test positive for elevated blood lead levels. Given that there is no safe level of lead in a child's blood and that the brain damage, IQ loss, and other harmful impacts may be irreversible, these findings are alarming. According to the FAA, there are 20,032 airports in the US. Most provide services to piston engine aircraft and as such are sources of lead pollution. EPA data reveals that 70% of all airborne lead emissions in the US, nearly 1 million pounds per year, are released by piston engine aircraft. Those stationary facility sources that release lead into the atmosphere are required to monitor when emission levels exceed the half-ton mark. Airports are only required to monitor if emissions reach 1 ton. A review of the NEI database reveals that between 2008 and 2017, the number of airports emitting a half-ton or more of lead per year doubled from 58 to 116. This lack of adequate monitoring helps to explain why so many children living near airports have elevated blood lead levels. In 2013, the EPA released a report on an airport lead monitoring study intended to measure the areas of maximum impact of lead concentrations at 17 of 58 US airports, emitting more than a half-ton of lead annually. This study was used to bolster the agency's claim that the current NACs, unchanged since 2008, are protective of human health and the environment. Unfortunately, there were many inconsistencies in the lead monitoring study, due in part to pushback from the FAA and the Airport Owners and Pilots Association. 2 airports were found to be in violation of the NACs. Both claimed these findings were caused by the placement of monitors near the engine run-up area. In response, rather than addressing the lead emissions, some of the monitors were intentionally moved to obtain lower readings. One of the airports included in the study was Reed Hillview, an airport that, according to EPA findings, was protected by virtue of being within the current NACs for lead. Even so, a Santa Clara County Commission study by Dr. Sami Zaran et al. Found that the blood lead levels in children living in proximity to this facility equaled or exceeded those found during the Flint water crisis. As Dr. Zaran pointed out, the Flint water crisis from beginning to end lasted 18 months. By contrast, the more than 1,000 pounds of lead released by piston engine aircraft annually at Reed Hillview was continuous and ongoing, day after day, year after year. To better understand why children living near airports have elevated blood lead levels, even though their neighborhoods were considered to be within the current NACs, Gary Keller, the co-author of our written submission, began to research the capacity of the filters used by the EPA to detect lead concentrations. 2 reports discussed in the Federal Register on the leaded aviation fuel endangerment finding stated that particles released by piston engine aircraft were in the nanometer size range, much smaller than the particles released by vehicles before leaded automotive fuel was banned more than 25 years ago. To gain greater clarity, Mr. Keller contacted current vendors as well as the businesses that provided the filters used in the 17 airport study. These companies informed him that their filters are not recommended for particles in the nanometer range. This means that not only were the monitors used in the 2013 study poorly positioned, their filters lack the capacity to capture much of the lead being released. Sadly, the lead they failed to capture shows up in children's blood. In other words, inadequate government mandated lead monitoring at airports results in the bodies of innocent, vulnerable children being used to measure air lead concentrations in the vicinity of airports. This is unconscionable and indefensible. For these reasons and others as stated in our written submission, I urge the CASAC lead panel members to issue a recommendation to lower the NAAQS for lead and to require airports to monitor lead emissions at their facilities. Please refer to our written submission for added details and reference material. Before closing, I wish to endorse the testimony submitted by Charlie Schlinger. Thank you for your time and consideration.
Okay, thank you. Thank you very much. Also just going to quickly draw attention to the panel to comments made from both the public as well as individual panel members on contributions from aviation sources as well. So appreciate your contribution to this meeting. Okay, let's circle back and see if Deidre has been able to get the audio problems worked out. Deidre?
Or Jeremy, do you want to see if the panel members have any questions for me?
Yeah, thanks, Aaron. Sorry, I'm getting up to speed with this role. I should have remembered that. Any clarifying questions from the public on Mickey's presentation?
I'm trying to find my hand. I can't find my hand. How's this?
Go ahead, Bruce. Yeah, you're
all right. Well, first I'd like to thank Mrs. Barnes for her work and for sharing these results with us. And I am quite troubled by the issue raised by Mrs. Barnes about whether the monitors are able to capture the emissions around the airports from the aircraft, and how that might have changed our ability to protect these communities. So I wonder if EPA staff could respond to the issues raised by Mrs. Barnes about the inadequacy of these filters, and whether there's any studies out there to try to look at their ability to capture these nanometer particles. Can we say anything more about that?
You know, Bruce, I'm gonna, with your permission, this is, I think you raise a critical issue here, and like I said, one that was addressed in several of the individual comments as well. Would you mind much if we circle back to that? And if I, for some reason, forget to address it, although I think it will be raised either in your comments or others, that you'll let me know. But rather than open it up to that specific question there, I kind of want Deidre and the EPA staff to present first before opening up to something like that, if you're okay with it.
Yeah. Absolutely. If we've got a place to begin to talk about that, I'm happy to wait. Thank you, Chairman.
We'll create a place for that. Yeah, thank you.
All right.
Any other comments from the public comment presentation? Okay. Deidre, it's how are you doing with the audio? That's not good. Okay. Okay, well, Aaron, what do you suggest?
Zach and Deirdre, do you want to try calling in with a phone so at least we can hear you?
Okay, we may have it.
Can you guys, okay, hang on a second.
Hang on, we tried the phone.
Can you guys hear me?
Okay. Yeah, we can hear you now.
You got it.
Hang on, we tried the phone and that did not work. So
Oh,
then we
okay.
went another way. Hang on a sec. I'm trying to get the volume up in here, Aaron.
Can you guys hear us?
Okay, can you hear us?
We can. It sounds okay.
I'm so sorry, everybody. I had called in on my cell and I was trying to, and I was off mute and you guys couldn't hear me. I was like yelling at my cell phone going, I'm here. So I'm so sorry for that. I know that everybody took their time to get on the line, and this is not the way we like to start.
Yeah, and so just a minute, what I was saying when you couldn't hear me, it was simply, I was going to turn it over to Zach, who it's the main event. Yeah. We're sharing the video so we can be in the same place. He can give his presentation, but we'll both be able to help with any clarifying across the REA or the review as it comes up. So I'll turn it over to Zach and he can pace through. As Karen said, the idea might be to take a break at the after the case study section in case wrap up any clarifying questions that people have outstanding there so they don't forget them before we move to a completely different topic. Great. Thanks, guys. And over to Dr. Picard.
Okay. And everybody can hear me? Can folks hear well? Okay. And once again, I apologize for that. That's not the way I like to start these things out. Okay. So just an outline for the presentation very quickly. We wanted to give a little bit of background, and I tend, particularly after the last 5 minutes, to go a little fast as I talk and try to catch up as a tobacco auctioneer, so I will not do that. I'll try to slow down. We'll begin by providing a little background on the risk analysis, on some of the key design elements broadly, just to get everybody to make sure we're sort of grounded as we dive into the two specific topics that we really wanted to talk to people about today, you folks, and that's the GIS, well, the case studies more broadly, and then the dust-led modeling approach that we've been working on. These are two areas. You know, the design of the risk analysis is largely where we left it, or it retains much of what we talked about a year and a half ago. But in the interim year and a half, we have been working very hard, both on the GIS sort of spatial analytical part of it, and then also on the dust-led modeling part, given how important those two key elements are. All right, so I want to make sure that
We'll do it. There you go.
Oh, yeah. Okay, great. Okay. So here we have just a list of some of the key design elements of the risk analysis. And once again, these will be familiar from the last time we talked about this. We're going to focus on young children less than 6 years of age and the IQ loss increment as a health effect endpoint. Obviously, young children, very sensitive age group that the IQ loss endpoint is obviously one of health significance. I think we all recognize that. More importantly than that, we want to make sure that whatever endpoint we model, we really are doing, we're choosing the endpoint in the age group that we think we can do the modeling with the greatest degree of confidence in generating exposure and risk estimates. And that combination of age group and endpoint we feel represents that. In terms of the elements, and Deidre, you watch if anybody has questions or pops up because I'm focused on the slides. Thanks, sorry, not to pull you up here. So in terms of the key exposure modeling elements, that air to dust led modeling pathway is a critical pathway. I think probably everybody, all the CASAC members are familiar with this, but when you talk about ambient air led, you focus obviously on inhalation. Direct inhalation is important. The other pathway that is really critical is the loading of indoor dust led by outdoor ambient air through air exchanges and so forth. Obviously much more complicated than that, but that pathway is a critical one. Other exposure modeling elements, we're going to use IEBK. We can talk obviously more about that. Some questions were raised, I think. We are going to use a GSD, geometric standard deviation approach towards characterizing inter-individual variability and exposure. What we mean by that is, and this is typical with IEUBK, we're modeling a central tendency estimate within a given exposure zone, and then using the GSD to translate that central tendency estimate of blood into a distribution of blood lead values for a set of children in that exposure zone. That's often done at Superfund sites and so forth. Risk assessment, we're focusing on the IQ decrement. Then with regards to case studies, a year and a half ago when we talked about the design early on, we had really focused on this generalized local case study. That is where you assume a hypothetical neighborhood of kids that's exposed at the standard level. And that's really addressing the policy question. What does it mean for kids experiencing that specific NAAQS level, or what of other alternate air quality scenarios you may be interested in? What does that mean for a group of kids exposed at that level?
But I think there's a lot of interest in also asking a question: what does this more broadly look like when we consider different air quality scenarios in a larger urban context where you have different exposure zones? You have a zone maybe near a point source that's going to be elevated very close, much more closer to the NAAQS level or the air quality scenario we're looking at, but also a broader complexity of urban distributions in terms of gradients in ambient light and demographics and how they interface. So we wanted to look at that, and that resulted in us identifying a generalized a location-specific case study that we wanted to identify an actual city, and we also wanted to include, if ideally within that city, and which is the case, a near source neighborhood to a larger point source, and we've identified that. Obviously, we'll talk about that. With regards to uncertainty characterization, just to touch base very quickly, we would include sensitivity analyses intended to focus on key elements where there are different modeling options, different input options to look at how the exposure and risk estimates are affected by those different sources of uncertainty. And then another thing we would do, I think we've done this in the past to a certain extent, but I think it's very valuable, is to ask ourselves, to what extent are we asking design elements of the exposure and risk analysis? We're asking those elements to perform out of their parameterized space. So if you have IUBK and that's been performance evaluated, let's say, through Bunker Hill data within a certain range of exposures, are we asking IUBK, are we using it, extrapolating it outside of parameterized space? Doesn't mean we wouldn't do that we wouldn't generate the numbers, but there would be increased uncertainty possibly. And we'd like to talk about what the nature of that is. Obviously, similarly with IQ, if we're modeling IQ at blood lead levels, most likely below some of the levels that are reflected in the underlying epidemiology studies, we'd want to know that and just convey that information as part of characterizing uncertainty. Okay. All right, so this diagram provides an analytical approach graphically of the overall analytical approach we're using in the exposure and risk analysis. A lot of detail here. I'm just sort of going to 10,000 foot flyover kind of describe it. And obviously we can go into more detail if we want. This is an ambient air quality standard policy analysis. And I think that's something that we'll probably talk about a little bit this afternoon when certain questions are raised. But, because we're really focusing on ambient air, it's important to make sure that we're considering the metric that we may be asking when it comes to a certain air quality standard. Obviously, the NAAQS having a certain metric design, but that's not necessarily the value that we would use in modeling exposure or risk. And so given the analytical approach that we've put together, the dust modeling, the blood modeling, the IQ response, the analytical time step that we're interested in is an annualized time step. And so we want to translate a given air quality scenario, which is going to be represented typically as a max 3-month average across 3 years. We want to translate that air quality scenario into an equivalent annual average value. That's a non-trivial task. It's an important task. So that's the first thing that you see there. Once we do that, then we conduct an exposure analysis. We are going to conduct, as we've done in the past, 2007, last time we did a very large analysis for this review, this kind of review. We want to consider all of the pathways so that we know what the total blood lead exposure is for the simulated children, each of the children that we're modeling, the group of children. And so that's what you're seeing here is a range of pathways covered. Beginning on the left, obviously, with direct inhalation. The oval, somehow it became Carolina blue. I don't know how that happened. In the middle there is addressing this issue of dust lead modeling. And it's identifying, we'll talk about this more in a couple of slides, but you begin with ambient air.
Excuse me, you're not
question?
sharing your screen. I can't, I just see you. You're pointing to something, but I'm not seeing it.
Oh, yeah, that's not. Oh, Aaron, are you? Is somebody sharing the slide?
Excuse me, Dr. Lamphere, can you see the slide?
No.
Can other people see the slide?
Yes.
Yeah, I see the slide.
See the slide.
Yeah, we can see the slides.
So
Yeah,
Bruce,
okay.
if you're on a phone or tablet, you may need to swipe screens.
Yeah,
I got it. I got it. Thank you.
Okay.
Got it.
Okay, great. Thanks for making sure that was clear. And so that the sort of the oval, yeah, I always want to say ellipse, but the oval in the middle there is identifying the dust lead modeling step, which is really critical. You go from ambient outdoor air to loading indoor dust lead through exchanges, clearances, and we'll talk about this more in a second. And then you translate that into dust lead concentration, which is what we need to do. We need to use to characterize that particular pathway when doing exposure modeling. And then on the right, you'll see that there are additional pathways: dietary, drinking water, and outdoor soil ingestion. Once those pathways are characterized, then you can conduct IUBK, use IUBK to conduct blood lead modeling. You'll combine that central tendency estimate of blood lead, multi-pathway characterization of blood lead, with the GSD, which translates a central tendency estimate of blood lead for a given exposure zone. We'll talk about what we mean by that in a second when we get to the case studies. You'll translate that into a distribution of exposures or blood lead values, and then you can apply the CR functions to translate that into a distribution of IQ loss. All right. So next slide. I think that's right. Okay, so the first topic we wanted to talk about are this case study topic. And when we were selecting our case studies, we had a number of criteria that we considered in making that choice. One of the first criteria we had was to make sure that we identified a location that had a relatively large emission source for lead, so that we would have a near source impacted neighborhood that experienced relatively elevated gradients, ideally fairly close to the current NAC standard, sort of naturally, given the source performance. And secondary smelters obviously would be the most likely candidates at this point in the country. The other thing we wanted to do is make sure that for the remainder of the broader urban area, we had relatively decent coverage. Obviously, that's a relative statement, by neighborhood scale monitors. So we could characterize more of the sort of it's not really a background urban concentration, but a more generalized urban concentration likely to see across a larger urban area, in addition to that more heightened, elevated gradient around the point source. When we applied those criteria, Minneapolis-St. Paul study area sort of surfaced as the best location. It's got relatively good coverage by monitors, and it also has a secondary lead smelter within that sort of broader urban context. All right. So next slide. So we'll get into a couple of graphics here that are essentially GIS plots or pick grabs. So this first graphic identifies that study area, the Minneapolis-St. Paul study area. And the red circles with the dots in the center are neighborhood scale monitors that were located within the area. And what we did is we identified a portion of the Minneapolis-St. Paul area that had a relatively higher number of these sort of neighborhood scale monitors. And we used the outer extent of those monitors to sort of define an apices around a polygon that would be the study area, and that's what you see here. The other points I would make: the blue circles with dots are source-oriented monitors, that we also identified and we wanted to make sure we sort of addressed. Obviously, of great importance to us was the one towards the bottom center, and that's the secondary lead source, secondary lead smelter. That's the location of the source itself, with the source-oriented monitor right there. We'll talk more about this in a few slides. Other sources of interest: there were two other sets of source-oriented monitors that were associated with metal recycling facilities. In the northwestern part of the study area, there was actually a shredding facility associated with a recycling facility, a metal shredder, that had a lot of political optics, had a lot of attention in the last 5 to 10 years. It was closed down, I believe, in 2018. And the ambient monitoring data at that site went from being relatively elevated, not as high as the secondary lead smelter source area, but pretty high relative to the area, the monitors around it. And those dropped off precipitously within the last few years as they moved that shredder, I think, to another location outside of the city. And then the other facility is to the right, sort of the upper right-hand part of the study area, is another metals recycling facility. And we actually ended up, it has slightly elevated source-oriented concentrations, and we ended up defining a slight gradient around that facility that we are including in our analysis. The other 2 points to make are that there are 2 large international airports within the study area, and we've definitely looked at those and addressed those in ways that we can talk about. So next slide. All right, so this slide gets into describing the way that we tackled characterizing or defining exposure zones within this city-specific study area. And there are really two types of exposure zones. One are the Thesian polygons, which are associated with the neighborhood scale monitors and represent the broader area of the study, of the vast majority of the study area. You can see one of those illustrated in the lower left-hand side of the figure. And so, a Thesian polygon is a geographic construct where basically you identify any location closest to the point associated with that polygon as being affiliated with that polygon. And so what you end up doing is defining a set of polygons within one of which all the points are closest to the monitors affiliated with that polygon. You do get sort of interesting spatial associations, and I'll be the first to acknowledge that here. So like in that case, you have a monitor in the lower left-hand part of that Thesian polygon. And yes, we would use that monitor to represent broadly the ambient air levels for the entire polygon and all of the children within it that we're simulating. There were 10 neighborhood scale monitors, again, the red dots that we identified, red circles, within the study area. And that allowed us to define 10 Thesian polygons. One thing I'll say, just sort of to provide a little bit of context, the design values affiliated with these neighborhood scale monitors are all in the 0.1 to 0.2 level, 0.01 to 0.02 level. So about an order of magnitude below the NACs and probably the other air quality scenarios we're interested in. That's just for a little bit of context. There may be a gradient across these monitors, but from a policy standpoint, given what we're using the monitors again to represent, and obviously there are a number of them, but they're obviously each one characterizing fairly large areas, we'll acknowledge that. All of those monitors are substantially below the current air quality scenarios that we would be looking at. That is not the case with the orange sort of oblong circular area towards the center lower part. And that again is the neighborhood impact zone affiliated with the secondary lead smelter. And the way we define that orange study area, the source impacted neighborhood area, is, and I'll talk a little more about this in a second, but essentially by taking air mod based results that we've completed as part of NATA analysis, National Air Toxics Analysis that EPA did. So fairly refined monitoring data, creating a set of modeling data, creating a set of isoplex, and asking ourselves at what point, or querying an isoplex for the point at which those isoplex reached the surrounding Thesian polygon. So what point does that elevated gradient fall to the level of the surrounding sort of urban area? And that's how we define that. We felt that was a reasonable way to define an area of obviously of elevated impact associated with that source. Another point we would make very quickly before moving on is in simulating, for instance, the current standard or the alternate standard levels, we would adjust that focused area around the secondary lead smelter. That area, even right now, is fairly close to the current standard. The peak isoplex in the very center is a design value. So we would be adjusting that up or down, that entire sort of surface. We would not adjust the Thesian polygons. When you look temporally at those neighborhood monitors back over the last 10 years, they've had that kind of 0.01, 0.02, maybe 0.03 design value pattern for many years as they've been reported. So it's been fairly low and fairly consistent over the last number of years. Okay, so the next slide. So this slide gets into a little more detail about that near source neighborhood affiliated with the secondary lead smelter. And I already covered some of the information here, but this just gives folks a little more of a graphic detail picture of what's going on. So we had gridded results, highly refined gridded results coming out of AirMod. 2018 was a simulation year, which actually was a slightly higher year than earlier modeled years in 2014. Not super much, but we were happy that it was a more recent year, but it also had fairly relatively higher ambient air concentrations modeled with the facility. So we use those AirMod results to create a set of isoplex. And here you can see those isoplex. I think there are 11 isoplex before you reach the outer one that define the outer extent of the study area based on the sort of the criteria I mentioned before it, the point at which that outer isoplex essentially reaches the surrounding urban level. And we used the annual average results. We had both design value results for the air mod, out of air mod, as well as annual average results. And we used the annual average results to essentially develop a set of scaling factors. The inner isopleth would have a scaling factor of 1, and then you would go further down as sort of a proportional relationship of each isopleth to the highest isopleth in the center. And you would use those isopleths to scale essentially the monitor-based value associated with the facility in the blue there. You can see it's very close to the facility. You would scale that monitor value based on the isopleth factors. So that's essentially using the modeling results from AirMod to scale the monitor value for each isopleth. And then we would treat each isopleth as its own exposure zone. So we would conduct separate exposure and risk modeling for the children that fall within each one of those exposure zones in terms of residential location. All right, next slide.
That's the end of
So
the
I think
case
that's the end of the presentation on case studies. And I think our thought was, if folks had any sort of technical clarifying questions, knowing we'll probably talk about other things later on, but just before moving on to the dust modeling, which is pretty different.
Any questions from the panel members? Bill? Go ahead. Yeah, Bill.
Yep, thanks. This was helpful, and they're the same pictures that were in the materials, but it's
yes, that's right.
Walk us through it. And I did have a few comments in my written comments on the Tyson Cartesian polygons. It's now clear to me how you are using the contour, so that is helpful. My main question, I guess, is you have AirMod. You've considered the correspondence a little bit between AirMod and the Thesian polygons, I'm assuming. Why not just continue to use AirMod generally? Because you have the various stations outside of the source area monitoring station that can kind of help ground truth, if you will, AirMod. It seems that AirMod, if you're relying on AirMod for the contours, why would you then rely on Thesian polygons outside these contours?
Yeah, Dr. Goodrum, that's a really good point. So one thing we definitely did was look, the drop off of those air-modded results is really substantial. So you get an order of magnitude, two orders of magnitude below the area source monitors fairly quickly as you continue that surface. That's just telling us that in a general sense, I think there are other sources besides that secondary source, that secondary smelter driving, whether it's entrainment of generalized dust, other smaller sources that are driving a generalized urban signal in that 0.01 to 0.02 to 0.03, right? But you get down those results and I was looking at this because of your comments actually before you came in here. It was down to like 0.0001 or 0.002. It was very, very low, and I think that it's dominant close in, and then yeah.
Got it. Thank you.
Sure,
Bruce.
Yeah, thank you for the overview. And I'm not sure this is the best place to ask it, but I wanted to ask it somewhere. Well, two things. First, I wonder if you could just tell us how you incorporated wind patterns. And then the second question had to do with, I think the approach you're taking sounds quite interesting. I think the case study location is beautiful. It's a really nice approach. What I'm struck by, though, is that you're making all of these modeling and then you're sort of accepting there's these assumptions. But why aren't you, unless I misunderstood, and you are, why aren't you using children's blood levels from these neighborhoods to verify the modeling that you're doing, to validate that what you're assuming is happening is in fact happening?
Bruce, that's a really good question. And this gets weedsy in a way that is probably super interesting to everybody on the phone. Certainly it is to me. And that has to do with that age of housing, I would say. And so, something we are really focused on is ambient air and what that is doing to a distribution of kids' blood leads. The reality, and so as you'll see when we talk about the dust sled modeling, we focused on newer houses. So we would get a clean signal on this sort of air loading indoor dust sled kind of reality. When you go into those older houses, if you start looking at houses built before like 1977 and some of the sampling data, and I'm sure folks are familiar with this, and before 1960, they have different, how they'll stratify the dust that's been collected. And you can see that the basic dust lead levels go way, way up when you start having older houses that have older historical sinks within them of dust, paint lead. And so my concern with using blood lead in general is you would get this combination of, it's an old city. It's got a lot of older housing. You'd have drinking water lines. You'd have old paint affecting those children along with our air signal. I think around the smelter, it may be at higher elevated levels, you get blood lead values that are driven largely by air. We're going to see, that's a question we have. But when you get further out, I think what you're going to see most likely is if we try to relate our air-focused modeling of exposure and risk to actual blood lead levels, unless we try to pull in treatment of paint in water based on housing vintage, which can be done, I think those things, and we found this when we started looking at it, start to swamp a lower level air signal that you generally see in an urban context. I'm not sure if that's helpful, but that was something we really struggled with, was making sure that we had an air focus so we could get an optic on that.
Right. I think those are all valid questions, but there's a simple way to test those questions, and that is to bring in blood lead levels, to bring in age of housing. You may or may not be able to get water lead concentrations, but it's easy enough to ask those questions, and studies have been done like this over the past 3 decades. Now, typically, it hasn't brought in air lead levels. That's what would be unique here. But the ability to see a lot of these nuanced exposures is actually, I've been quite impressed with the ability of GIS to get a hold of a lot of that. And when you talk about extraordinarily high dust lead levels, they'll be higher, but the EPA has consistently overestimated the extent of dust lead loading that's out there. That's why it took so long to get those residential dust lead standards down to where they're close to protecting children now. So I absolutely think you could look at this in context of housing age. You can get that, right? That's housing assessors data sets. You can look at that and test those questions that you raised that you're worried about. And they're certainly questions you should be asking. But the point is, you can actually test them using the data that's available to you.
So if I could just say, those are all interesting points that we'll be considering. And I think one thing I noted in looking at the comments was, I think you and someone else mentioned, well, there's lots of blood lead data from Minnesota. And I think that will be interesting to think about in terms of evaluation. Where do we fall in terms of the blood leads? But I think recognizing the policy focus for this assessment is on the risk associated with the ambient air standard. That's really our focus, not the risk associated with leaded paint in dust that may still occur in those houses. We use Minnesota as essentially a hypothetical population. It's sort of a ground truth based hypothetical population, but our emphasis and our purpose has to do with risk associated with air related lead for the standard, the current and alternative. So that's kind of our focus, but I think it will be interesting to see what do the local blood lead distributions look like. So I think that will be something that'll be interesting to come into the characterization of uncertainty, variability, and model evaluation. So we'll certainly speak to that. You had another question I want to make sure we didn't lose, had to do with wind.
Well, no. Let's get back to this first one. This is more important. The reason I brought up this point is, in fact, because you're interested in air lead. And if you don't take into account those other factors, you can't estimate the contribution of air lead. You're guessing the contribution. And one of the things I'm struck by is, we just went through this exercise last year where we looked at all the evidence for the ISA, and we were very critical about the quality of the data. How much are we basing on objective measures, and how much are we basing on unmeasured variables, for example? And what you're doing here is you're taking all of that rigorous evidence, as much as was available, and now you're ignoring all these other sources. And how can you actually quantify the contribution of air lead unless you take into account those other sources?
I think the way, so when we talk about the dust sled modeling, you'll see that in structuring our dust sled modeling, we wanted to get a dust model that related air to indoor dust, realizing it's air to indoor dust plus an increment of old house paint that could be in that dust. I understand that. But if you're talking, another way of saying it is, what if you had a kid that's living in a clean house and is exposed to only the air signal and generally to other things? We can do a what if increment. We can do an old house lead paint increment in dust on top of that. That's, you can do that off of the AHHS 1 or 2 data sets. You can look at housing vintage and what's an additional dust lead increment. So now we're simulating a kid that has non-air as an element. And maybe that's an extra 3 micrograms per deciliter, or 2 micrograms per deciliter, whatever it is, I'm not sure. But from a policy standpoint, the question we're going to ask about is, what's the air-related risk? And what is the reduction in air-related risk associated with a NAAQS adjustment? If I'm not getting ahead of ourselves, but given the current NAAQS, what is the air-related risk going to be to a child? What's the magnitude of that IQ loss? And I think if it's there's an additional dust component they have, that's not going to affect that increment of IQ loss associated with air. In fact, we're in a linear space now, but you're well aware of the fact that often we would have this sort of linear relationship where slightly higher blood lead actually got you to a flatter part of the CR function, ironically. And so from an air standpoint, the increment in the past, certainly in 2007, we had this issue, that if you started considering more highly exposed kids, sometimes that increment was occurring at a higher point in the distribution that was actually flatter with regards to IQ loss. So my only point for saying that is, I'm going a little far afield, if we're focusing on air-related exposure and risk, I think keeping an eye on that we're asking about that air-related IQ loss, we could say in a kid that's living in a more pristine house or a kid living in an older house, it's likely to be a similar increment given the dust modeling, air part, acknowledging that they could have a larger increment from these other non-air sources. If that makes sense.
I'm sure we'll come back to this, but I'll just let Brian and some others.
Yeah, I was going to say the same. I think that this is going to come up in subsequent discussions as well. And there are a lot of comments about sources of uncertainty, how it propagates through the models itself. And I expect that this is going to be a topic of discussion throughout. So, Brian?
So given what you just said, I can bring this up later, but Deirdre, I was at least one of the other ones who brought up blood lead levels. And blood lead levels are way more extensive than some of the data you have. They're way more recent than some of the data you have. And they're available for more than just Minneapolis, St. Paul. And I don't know if I'm thinking about this fully yet, but you could skip the dust lead concentration step, just go straight from air to blood lead with the appropriate sort of spatial statistical model that brings in all the air sources, including, as Mickey pointed out, all of the airports that are across the whole country. So it seems to me a tremendous missed opportunity to try. I understand that the EPA and CASAC are focused on air lead, but we can get to air lead backwards from lead dose as opposed to going forward from these kinds of models that you're using.
Yeah, if I could just make sure folks are aware, we look at all of this evidence, right? I mean, so we're focused today on the quantitative risk and exposure assessment. We also do evidence-based analyses where we pull in the policy assessment, pull in the information from the ISA and look at it from different angles. And one of the things that we've looked at across reviews from the initial setting of the standard in 1978 was, what are relationships between ambient air and young children's blood lead? And there have been a number of studies that were available way back when, kids near smelters, et cetera. There have been, in the review we did in 2007, 2008 standard review, we looked at relationships between, lead in air, lead in children's blood. We looked at it again in the review that completed in 2016, I want to say, and we'll have it again this time. I mean, that is part of the set of evaluations that are done in the policy assessment. But the focus today is on the quantitative risk assessment, where we try to home in on what can we say or understand about when the air quality conditions are just meeting the existing standard or potential alternatives, what is the related lead exposure and associated blood lead and associated risk? That's kind of what the overarching question is that these quantitative analyses are aimed at. But we do look at the evidence that exists from other studies to the extent we can pull it together in different ways. Hopefully that's helpful.
Okay, Kathleen, you've had your hand up for a while.
Yeah, I just want to bring in the fact that in California, in our hotspots program, we have a number of transfer coefficients from homegrown food and vegetables, that sort of thing, as well as mother's milk. They're coefficients of transfer based on the ambient air concentration. So I don't know if that would be helpful in trying to fill in some of those areas of other sources from ambient air transferred to child exposure.
Thanks. What was the program you mentioned? It sounded like hospice, but that can't be right.
It's called the hot spots.
Thank you.
Yeah.
Thanks, Kathleen. Mark, I'll get to you in a sec. Let's remember that we still have to actually get to the question of the presentation on the dust-led modeling, which is clearly very related to some of the discussions that we're having now. And then some of the feedback that we want to give to EPA, let's try to kind of save that for our discussion, our formal discussion, and kind of keep this more to clarification questions at this time. I don't want to stifle the discussion because it's really important and really actually interesting. But yeah, Mark.
Okay, then I'll just defer to later, but just quickly say that I sort of wanted to, I'm sort of seconding what Bruce and Brian are saying, and I'd like to come back to that later too, because I'm still not sure I'm understanding why the current path is being taken. But.
Yeah, and I can only say that in reading your individual comments, I know that this is going to come up in the discussion. So yeah, we're going to come back to this. Any other clarifications on at least the case study design component that was presented? Yeah, Chris.
So yeah, clarification wise, or maybe to leave some of the bigger questions to later. Did I hear you say that you are now planning to include at least one? I think you used the term international airport in your case study analysis.
So I'll because I think this is also a comment that was made. I think some of the folks commented on this. We consider those two airports. There's a 2020 EPA report that had regression analytics. Well, it was air.
Sorry, I just want to set the stage a second. So the airports are in the study area, just to confirm.
Yeah.
And they were in the figure. You might want to pull up the figure.
Right. Well, so there are two international airports that are within the study area. Yeah. And there's a 2020 EPA report that did air mod-based simulations of run-up activity, and it had in one of the tables, it has distance sort of decay concentration measurement modeled simulations away from the run-up period where you have the high idling activity. And we use the highest activity row, so the simulation they've done for the highest activity airport, simulated airport. And we looked at the distance at which you got down to a concentration that was the Thesian polygons surrounding those airports. That's at about 200 to 300 meters from that run-up location. And these two international airports, because they're international, they're larger municipal airports. The nearest residence to the run-up locations is 350 meters for one of the airports and 650 meters for the other. And at that point, given the air modeling that was done, the ambient air levels that you're going to have are going to be at or below the sort of surrounding generalized levels. So we did essentially it's a site-specific screening analysis based on that 2020 EPA document. And so I think that if we had a smaller airport within the study area, you might have in residents nearby, maybe you'd have elevated levels that were close. But in this case, we screened out the airports in terms of impacting nearby residential areas using the 2020 analysis.
So there are the two international airports, but there are no smaller general aviation airports in the study area.
Not in the study area. That's exactly right. Yeah.
Sorry, Susan, Judy, and then Leanne.
Yeah, I just wanted to second Chris's comment. I wanted you to explain how you accounted for the airports. That was very helpful. Thank you.
Sure.
Judy?
Thank you. Yeah, I'm kind of troubled by the lack of consistency with those presented in the volume 3 of the RRP and all the ISA. Now, I mean, Minnesota, I'm not quite, I think it seems like a good selection, but none of this was discussed in the previous document. That there was information on the temporal spatial variation of the land concentration. Give us some perspective of how many children less than 6 years old is in the study area, what are the study area, and what are the blood level, land level, that in the area would be really helpful. That as I presented in my comments, that there's two orders of magnitude differences with the Gopher secondary smelter site as compared to the other site, with a lot of spikes over the past 10 years. And that using the level is much lower, much higher than the 0.00125 microgram cubic meter used for annual average. So I'd like to see more detail. How do you derive that value? How that related to the actual values? I know that actual measurement in the area to give us some better perspective and better before you dive into the modeling.
Thank you, Judy. Leanne?
Yeah, I just wanted to clarify, we've had some discussion about the two airports being international airports, and this just shows my relative level of expertise compared to some of the other people on the panel. But my understanding is the concern about leaded aviation gas is really about small airports and is not about big international airports because of the different fuel that's used for the different kinds of airplanes. And so I'm actually quite concerned, and we've had several public comments about the importance of exposure to communities from leaded aviation gas, and that seems to be not included in this at all, is my sense. So maybe comment on that.
Yeah.
Just first, the international airports do have general aviation planes as well.
Well, it's piston engine. It's piston
Yeah.
engine aircraft that use the leaded fuel for anti-knock capacity. And yeah, in this case, it's a good point. We didn't choose a study area to avoid airports. I mean, we chose a study area for the large, the secondary lead smelter and having general monitor coverage. We saw the two airports. The assumption we made, which frankly we're not even sure is the case, I mean, we know they have piston engine aircraft. I mean, just because it's a large airport doesn't mean it doesn't have a fair amount of activity from piston engine aircraft. And we did a screening where once again, we assumed the highest level of flight takeoffs that were simulated in the 2020 document. And we put that at the location closest, the runway run-up location closest to residences, and we evaluated that. I think it is a screen that shows that at larger airports for this particular issue, you're making a good point that may not be the critical issue. That if you had a study area that had a smaller airport with residences closer by that had a lot of piston engine aircraft, you might get closer to that gradient. That obviously the peak values are within 50 meters, 60 meters of the highest sort of idle location, I think, at least from what I've read, and they drop off fairly quickly. So it's a good point. Just in this case, we didn't have that. So yeah, so there's activity there, but it's a good point that in this case, part of the issue is that you just have large boundaries at a larger airport, and residences are further from it.
Right, but regardless of the source, we do have a source that will give us the air concentrations at the current standard and alternatives, which is the assessment that we need to do regardless of what the source of the lead is.
Right, and we do have, near that secondary lead smelter, you do have residential, kids living in the first several isoplests that are fairly elevated close to the current NACs. And the other thing I'll just remind folks, that generalized local case study, the whole value of that, in fact, there's some here who would say that it's a super important analysis because it says, what is exposure and risk for kids at that standard? If you have a neighborhood at the standard, What does it look like? That's what that case study does. It says, what's the distribution of exposure and risk for kids living at that standard level? It's going to, it's going to have a distribution, but assuming essentially a uniform ambient air concentration across a neighborhood of kids. And we did that last time in 2007. That was a similar analysis. We're sort of using a similar kind of approach. So there is that case study, which is a generic neighborhood case study for risk at the standard. What this is intending to do is try to provide a more comprehensive picture of the complexity in a larger urban area. We have some kids living near it, and something I think folks know, but just to be clear, we are going to pull out that secondary lead smelter impact zone as a separate case study and look just at that impact zone along with the overall urban area. But yes, Dr. Shepard, a small airport probably would have folks closer to a gradient. That's true if they were living closer to the run-up.
I mean, not only would it have people closer, but it would be a larger fraction of the flights that would be spewing lead.
So that's not the case, because what we did is we used the simulation for the most high frequency simulated airport we had in that 2020 document, which is, I'd have to pull it like 15,000 takeoffs a year, whatever it was. It was the first column, there were 6 columns of activity. And we use that first highest airport activity screen. So essentially you're saying what the highest activity we've seen in any airport, let's say it's happening there. The reality is if you look at those model gradients, obviously it's modeled. So let's ask about confidence and stuff. But if you look at the gradient drop off, if it's fairly steep in terms of the gradient at distances going 50, 100, 200, 300, 400, I think out to 500 meters. And that's what a lot of people talk about is, within 50 to 100 meters, you have fairly steep levels associated with those run-ups, but they do drop off.
Because I want to make sure that we do get to everyone's individual comments and open the discussion up more broadly. I do want to move on to the presentation for the dust lead modeling. However, it was brought to my attention that Bruce's comment about how wind direction, wind speed is incorporated into the modeling. I don't know if you can address that very quickly, or.
I would say that it was done the way it would typically be done for a data analysis. I would have to look back at the specific details. I'm sure they used an airport, a Met station nearby to get the wind patterns that were fed into it, I would assume. I obtained this from air quality modeling folks, so we can put a little more detail into the write-up on that. I'm sorry, I don't have more detail on that.
Thank you. All right, Zach, you want to go ahead with the second part of the presentation?
Yeah.
Slide 10.
Yeah, so slide 10.
Sure. Yep.
Aaron, if you want to.
It's Will, I think. Yeah. There you go.
Okay, so is that everybody can see that? Okay, good. So I've been talking a lot, and I don't want to necessarily talk more than I need to, so I'll try to make this fairly quick. So this is a figure that you folks saw in the memo itself. Conceptual framework for how we approach modeling, just so we're on the same page. There are really 2 steps to the dust lead modeling. Going at the top from ambient air, and the first step is to look at the way outdoor air is exchanged with indoor air. You have various processes in play: cleaning frequency, deposition velocities, penetration efficiencies, if we're doing a mechanistic approach. All of these processes for getting lead into the indoor environment and to have it load dust. And obviously dust lead loading is micrograms of lead per surface area, usually foot square of floor or other surfaces in the house. That's step 1 of the modeling approach. The second step is to get from loading to concentration, because the exposure modeling that we do has children obviously ingesting total dust, and you need to have a fraction of total dust that is lead. And so you need a dust lead concentration. So that's step 2. And that is anybody who's worked with this, I'm sure a lot of folks on the phone know that step 2 sounds simple, and it is not, because there's a lot of uncertainty in translating dust lead loading to concentration. So when you're doing step 1, you can use a mechanistic approach, a compartmental kind of flow model, this dynamic model that you saw for steady state and an analytical solution. That's what we did in 2007. You can also use an empirical approach where you basically have data on ambient air lead and dust lead loading, and you run a regression on that and derive a relationship, an empirical approach. For step 2, I mentioned mechanistic there. You could conceivably do that. I've not seen that done very much. Usually it's some kind of a statistical regression relationship that relates measurements of dust lead loading to dust lead concentration from data sets collected in housing. The other factor I'll mention very quickly in the lower right there is something we've already talked about a little bit, which is the important role of paint in housing age in this, because we are looking at air loading indoor dust, but the presence of historical artifact lead can be a very, very important factor to consider statistically or mechanistically. Okay, so next slide. So this, I don't think we had this in the memo, but what we tried to do here is illustrate what we did last time in 2007. Just, I think everybody's familiar with this, but the risk analysis in 2007 ended up being part of justification for a reduction of an order of magnitude in the lead max at that point. That risk analysis involved a lot of, I think, comprehensive research and work, part of which was in this area of dust lead modeling. And what you're going to see in that first set of gray boxes, the main approach, the hybrid approach, was something we put a lot of effort into at that point. For step one, getting from air to dust lead loading, we had a mechanistic compartmental model that we parameterized. We did a lot of work on, and that was a key element back then. And then for step two in 2007, we used a two-stage regression. The model results on dust lead loading were wipe equivalents. This is a lot of stuff we get into, but they were wipe equivalents in terms of what was being generated. The data set for converting loading the concentration, for doing step two, is a HUD blue nozzle collected data set. So it was a vacuum-based data set. So the first regression was to convert our wipe modeling results for loading to vacuum equivalent loading estimates. So then with the second equation for step two, we could convert loading the concentration using the right metric. That's why you have a two-stage regression there. The other things on the right, the other two gray boxes, basically identify regression modeling models that were developed for going from ambient air directly to dust lead concentration. Those were based on older data sets. Like, we can get into detail if folks want. I'm not going to cover those more. They were basically based on an older time frame when we were dealing with higher pollutant levels. We don't think those regression results are relevant now because we're now looking at lower levels. Okay, so next slide. So this now illustrates kind of what we've done in the last year and a half. And the first thing we did is we looked at that hybrid model that we had developed, hybrid mechanistic empirical, the thing that I talked about a second ago. And we basically said, hey, in the 2007 model, how can we update that? Can that be updated? Let's look at that. So the first thing we did is we looked at the mechanistic model, that compartmental model, and we looked at the 6 key input parameters to that model, and we looked at finding newer data and doing basically an updated parameterization of the model. We did that successfully, and that we now have an updated mechanistic model we're now calling the 2024 model. So that is a mechanistic compartmental model that we've updated with better parameterizations. I know we didn't provide detail to you folks in the memo. That's something we're finalizing the descriptions and stuff, and that'll obviously be well discussed in the REA. The other thing we did is we said we had this two-stage regression relationship for completing step two in the 2007 analysis, the two-step regression I just talked about. What do we feel about that? And when we actually went back and we looked at that, in particular in relation to the pollutant levels we're now dealing with, which are somewhat lower, we actually found that the data sets underlying those two regression models were still reasonable. In particular, the HUD data set collected in 1989 to 1990 actually had a relatively lower level of dust lead contamination that seems relevant to where we're asking the model to simulate now. And so we, through that process, essentially had an updated hybrid model, a revised mechanistic model, and retaining that 2007 two-stage model. We also, and this has been a lot of effort we've done over time, and there have been some other things that we talk about in the memo, other efforts that we tried that did not work out, but were part of our effort, which we can talk about if folks are interested. But one of the things we did do is we identified an empirical approach for doing step one. So for going from ambient air to dust lead loading. And what we realized is we have dust lead loading concentrations collected at 2 different points in time. And we have we can identify matching air quality data. And so we basically have, over about a 15-year period, dust lead concentrations, sorry, I need to be careful about this, dust lead loadings going down over that 15-year period, and we can match that to ambient air data that are going down. So we have a time trend. It is a crude time trend. In the next slide, don't go there yet, we'll talk about that in more detail and we'll lay it out. But that was basically a time trend-based empirical model, very simplistic, to derive a relationship between ambient air lead and dust lead loading. Okay, and then the other thing was, can we do a better job in going from dust lead loading to concentration? Bevington et al. 2021, probably familiar to some of the folks on the phone, is basically a series of pooled regression models, pooled analysis-based regression models that were developed for going from dust lead loading to concentration. They basically looked at 5 different data sets and did various aggregations of those data sets and derived separate regression models. We looked at those and identified number 7 as what we thought would work best. And so we chose that as another option for completing step 2. All right, so next slide. And like I said, I don't want to, I'm going to move fairly quickly through this. So if we have maybe questions afterwards about some of the details, I can talk about it, but I don't want to be talking more than I probably should. So this lays out the delta factor approach, which is that time series based approach relating dust lead loading at 2 points in time to ambient air quality data we got from the AQS. It is a very crude approach. It is using median dust lead loading values from 1 point in time, 2005 to 2006, and then median dust lead loadings from more recently in 2018 to 2019. Those are coming from the AHHS American Healthy Homes Survey 1 and 2. And we could then identify median ambient air lead data that matched each of those points. You get 2 points and you fit a line through it, and that gives you a relationship. An important point here is we base this, the dust lead loading data, we based on the subset of houses built after 1977. This is getting to a little bit of Dr. Lanfear's point that he was raising, and we were talking about back and forth a little bit. So we focused this empirical relationship on houses that were built after lead paint was phased out. So we would really have a time series tracking mainly, we would hope, air. It's a time series. So there are other things that are changing. You know, whatever sinks there are out in the yard, they're still maybe in the house or being painted over. There's burial, there are other things that are happening. So we're not sure that this time series is capturing only the effect of temporal changes in air. There may be other factors. HVAC system technology changes. Houses do get more sealed up over time. So there are other issues that might be at play, we realize. Okay. All right, next slide. So this simply lays out, it repeats the previous slide. It shows the delta factor slope, the blue dotted line, and then we superimpose the refined 20 and 24 hybrid model, which is our other modeling approach for going from air to dust lead loading. And we also include the original 2007 hybrid mechanistic model here, just sort of to give folks a sense of how they seem to line up with each other in terms of making estimates. Okay, next slide. On this slide, we consider step 2 in the dust lead modeling. Step 2 is, again, going from dust lead loading to dust lead concentration. And this simply plots out the 2007 two-stage approach that we used. That's the blue line on the bottom. There are 2 regressions that are sort of combined in that particular model. And then the Bevington model 7 is above it, which actually we would argue also, in a sense, combines 2 regression models. One thing to keep in mind with Bevington's number 7 model is it uses 3 underlying data sets, including the HUD data set that we used in our 2007 regression. So that 1989 to 1990 HUD data set is also used in the Bevington pooled analysis. And they included a conversion that was necessary to convert the HUD data. In their case, they were converting it from a vacuum loading to a wipe equivalent loading, or concentration, sorry. So they had a conversion that they had to complete. That's getting very weedsy, but this basically compares the 2 approaches we have for completing step 2 of the dust lead modeling approach. Okay, next one. So this slide, again, from the memo, shows how sort of basically shows on the X you have ambient air level. On the Y, you have dust lead concentration. So this is sort of putting it all together. And essentially, we have 4 dust model options that we are now looking at. And here we have those 4. We also include the original 2007 hybrid in blue, just for completeness. What did we do in 2007 in terms of going from air to dust? And what are the 4 options we have now? And you can see the 4 options we have now are grouped essentially according to that second step to a certain extent. If you use the model 7, you get slightly higher predicting models. If you use the 2-stage model that we used in 2007, you get slightly lower models, but this sort of provides those. I think the other thing that's important and maybe relevant for folks to anchor on for a second is the set of dots on the very left-hand side of the plot. Those are affiliated with ambient air levels that you're likely to see across those Thesian polygons. The higher set of data, the grouping of 4 simulation air values that you see in the right, are around the current NACs. So this is just giving you a sort of a little bit of context for what you might see when we're thinking about the current NACs and around that, and then where the remainder of that urban study area is, which is over on the left, pretty close to 0.01, 0.02, 0.03. Okay, next slide. All right, so this is where I'm going to say, rather than sit here and spend the remainder of our 2 hours reading through this, we can talk about any of these points in greater detail if folks are interested. But we try as a team, I think, to make sure we lay out strengths and limitations of various modeling options, and really that helps us to guide sort of our thinking about which model we favor for like a core analysis versus which options we are considering for more of the sensitivity. And you can see on the left in the sort of Carolina blue again, we're focusing on the 2024 hybrid approach. That's the 2024 mechanistic with that 2-stage regression. We think we have reason to believe we have a little more confidence in that pairing. And then the other options that we've talked about in the memo, and I've just gabbed about for a while, the delta factor approach for step 1 and Bevington's number 7, we would definitely include, but more sort of as a sensitivity and alternate simulation approach to provide a bit of further characterization of uncertainty, confidence in the overall modeling strategy. And so the next slide, please. And this just essentially says what I just said, which is that we're so I won't even repeat this because I basically just made the point. So that's the end of the presentation. If folks have any clarifying questions on the dust modeling topic.
Okay, thanks, Zach. Before I open it up to the panel, again, let me just remind everybody to try to kind of limit it to just clarification questions at this point. Anybody? Okay, I think that we're going to kind of circle back to some of these specific issues in the individual comments. And that's actually what we're going to do now. But before we go on, anyone have anything else that they just want to say at this point, or not related to the presentation? Okay, good. So I think that the way that we should do this, although each of the 2 primary topics, they're certainly interrelated, but I think let's open it up to individual comments related to the case study design, like you presented it, and then make sure everybody gets a chance to speak, and then talk about the dust lead modeling part. We're going to do it. This is different, that we don't have to kind of get a consensus document out of this. This is a consultation. And I'm just going to kind of open it up to people by having you raise your hands like we did before. I'm going to just take a little bit of chair privilege here and just ask a broader question, or make a couple of quick comments here. Number one is I want to just thank the EPA staff for calling this the second consultation. This to me is kind of rare for various stages of the NACS process to have multiple consultations. slightly unusual. But I do think that it kind of speaks to the commitment of EPA staff to try to get this right, at least the REA part of it. So, and that was really evident in the presentation that you gave, and in really trying to really trying to kind of think through a lot of the questions here with this modeling approach. I will say that especially since I came in the middle of this process and have been trying to kind of get back up to speed with what has been done from the first consultation back in June of 2023. I was hoping to sort of find that there might be some record of how the feedback from that initial consultation was actually incorporated in the planning and the revisions of the REA, and wondering whether or not that if there's any document or listing or some sort of record of how you took our comments as a panel from that first consultation. It would be really helpful to sort of see, even seeing the highlighted parts to the presentation that you put up there was useful to me. So I just kind of want to pose that to Deidre or Zach right now. I did actually go back and look at the individual comments from that June meeting as well, and I noticed, as was mentioned in some of the individual comments, specifically from Leanne, that there do seem to be some points that were raised from the June 2023 consultation that are either unresolved or not clearly incorporated, in what your plans are. So yeah, let me just stop there.
So I'll just say, as you mentioned, having a second consultation is not a usual path, right? And so usually we take a consultation, and not just the written individual comments. That's not the only feedback that we take from a consultation. We find a lot of value from the consultation that comes from the conversation in the room, if you will. That's really the value of a consultation, that people are focusing and thinking about what's going on, thinking about what they now understand to be being talked about, and you get some really good feedback there. And so that as we do in every review, in this review, we take that back in the work we start doing on the REA. And so the evidence you will have of our consideration of that input will be in the REA that comes to you next year with the draft PA. That will be where you will see how we have considered the different parts. We're coming to you now with something additional, because as we work through some of these two issues, some of which we got comment on before, some of which we didn't get comment on before in the other consultation, we did a lot of work. And in doing a lot of work, it took a lot of time, and we thought, it would really be good to update the panel on what we've learned, where we are, and how that is looking for us taking that into the REA. And so the input we get from you all now in individual comments and in the conversation that you have with us in the room, so to speak, the virtual room, that will then go back to us in implementing the REA and in writing it up, making sure I understand. And one thing we continually understand is the importance of clarity and completeness and transparency in what we write, because so much, once you get in the room, you can explain something and people will say, oh, I didn't get that from what was written. And we're like, oh, if we'd only written it that way, right? I mean, you don't know until you do it. But so we will try over and over to make that work. But so I've talked a little more than addresses your question, but hopefully that explains how we consider consultation feedback and how it then gets evidenced into the work that we do. It's an early input activity, obviously.
Okay, thank you. And I'm definitely not insinuating that you dismiss the initial set of feedback from the panel. And in fact, it's your prerogative to dismiss what you want. It is a consultation here, right? And we're here in an advisory capacity to kind of help you plan this thing. And I also appreciate the comments of wanting to be as transparent as possible about the things that you did implement and put in, and the things that you chose to do differently. So,
and I think the one clarifying I'll just make very quickly is, I think the other reality is, ideally we would have made the progress on planning for the dust modeling, for instance, in coming to you last time. We thought we were close, and then when we started digging a little more, the methods development became a bit of an iceberg that looked different. It became a complex kind of thing. And that's part of a reason now for saying, given this thing that we thought we had wrestled down that became something larger, we'd appreciate your feedback on that. So it's sort of like it's a fairly focused feedback on key, obviously very critical elements of this, with a lot of work having been done over the last year and a half and feeling it would be valuable and circling around on that particular topic because it was so critical.
Right.
And the GIS stuff too.
Yeah, I think we all appreciate the work that you guys have put into this, and also appreciate the chance for a second consultation. Okay. Is the panel ready for a Wild West right now? Can we open this up to individual questions here? Okay, I'll take that as a yes. All right, so let's start with the first charge question, and for those of you, you should know what the charge question was, but what are your views on aspects of the location-specific case studies with regard to the boundary delineations, approaches to assigning ambient air lead concentrations to case study populations, including in near source areas, and then the strengths and limitations and uncertainties. We've already kind of ventured into some of these topics, but let me have the panel members raise their hands, and I'll call on you. Or do you want me just to call on you on the spot? Okay, Bruce, go ahead.
Yeah, thank you. Well, I mentioned this already, but I'll reiterate that I think the case study location was really creative. That you've got, in contrast to many other places, you've got some air samplers for lead. That's useful. You've got some higher versus lower exposures. That's really valuable. So I really like the case study location to begin with. In terms of the uncertainty that you raised, I think what I find challenging is, typically when we do studies in EPI, we like to find ways to reduce uncertainty. But the way you're incorporating air lead to dust lead concentration, that whole range, at each step, you're adding an extraordinary amount of uncertainty. And you described it that way, that there's uncertainty, not only from converting your vacuum sampling value to your wipe sampling value. Now you've got to convert from your dust lead loading to dust lead concentration. And those are not, as you know, 1-to-1 or even 0.5 to 0.5. We didn't even get into the question about what surfaces are you trying to get at. Are you looking at floor loading? And if you're looking at floor lead loading, then we should be looking at values of concern would be around 2.5. As you know, with your, well, now I guess they set them at 5, but they should be 2.5 to protect kids. Or are you looking at window sills, which are a magnitude higher in some cases? Or are you looking at trumps? So I wasn't even quite sure what surfaces you were looking at. But at each stage, you're adding all these uncertainties, and so I don't know any longer what to trust if with every step adding uncertainty. The only thing I can come up with is how do we minimize uncertainty? And now I'm back to this question of using blood lead levels, because you've got a dozen or so air sampling, but you've got 5,000 kids being measured every year. And as we did at the Reed Hellview Airport, what we've learned is that kids, unfortunately, are really good ways to measure airborne lead, right? When we're not doing it with our network of air samplers, we use kids. And what they're telling us is the exposures are too high. And that's why I think it's so important, even if you do everything you've said, which is fine and may be valuable, how do you validate it? And I would suggest the best way to validate it is using your receptors of interest, in this case, children. We know they're good monitors for airborne lead, and you've got 5,000 measured every year. Use them.
Okay, thanks, Bruce. There's a couple of kind of overarching themes in your comments there that also hit on the second topic, which is the dust lead modeling, of course. But I think this question of uncertainty, how it's incorporated into the model, and reducing uncertainty clearly is it affects both of these components. But yeah, let's Susan.
Yeah, thanks. I want to add my thanks to Deirdre and Zach for the presentation. That was really helpful. I have a kind of philosophical question about the sort of location-specific case studies, and that is, you talked, Zach, I think you alluded to trying to identify communities for case studies that had some population diversity, and I wasn't clear how you were going to incorporate that. So, for example, I think there's increasing evidence that some subgroups of children, based on a bunch of structural and other sort of social determinants of health, are more susceptible to toxicity from lead exposure and may even have more long-term impacts from lead exposure. And I appreciate the Canfield study. I don't think looked at that kind of effect modification, but is there any possibility within your case studies to consider that? And does the St. Paul, Minnesota area give you an opportunity to do that in terms of variation in vulnerability to lead? Or is that not something that's traditionally part of these assessments and therefore not easily incorporated?
I'm going to take a crack at that, and I'll hand it to Deidre because I think she may have a better perspective. I think there's what can you do quantitatively with the data you have in the modeling chain. And so I totally appreciate the points you're making, and I think you can describe how surveillance shows blood lead distributions are different for different demographics, SES status groups. Totally appreciate all of that, and I think certainly by focusing on neighborhoods near this facility, we're getting a subset of, we're focusing on the child age cohort that's of greatest concern. But our ability to tease out response functions in terms of CR functions for IQ loss, I think, to do some of the blood lead modeling that would be particular. I'm not sure that we're in a position to do that. If folks, this is what we always say, if given sort of the modeling framework that we have, if folks have suggestions for input data that allow us to do that kind of differentiation, to put like a different dial on elements of the modeling frame, I think we're certainly open to seeing and hearing that. And it's not that I don't agree that that's a concern from a surveillance standpoint for sure. But the modeling chain that we have, I don't know that we can do that quantitatively.
I think it's a future aspiration, because I do think that if the goal of the standard is to protect vulnerable populations, figuring out how to optimize that is a appropriate thing to consider, but sounds like it would require reframing your approach in a pretty fundamental way.
I would say the Canfield CR function definitely was focused on, I think a more
economically
disadvantaged cohort for sure. And so you have that reflected in that particular CR function we will definitely be using.
Right. And so we do rely on the evidence and what studies are available. And so that's kind of the limitation. I will say, in terms of looking at variation in blood leads and variation in potential exposures across different subgroups, that is something we try to discuss in the PA, where we have a section on at-risk populations and public welfare implications. We try and look at, for example, who are the people living in areas that have air concentrations near the current standard? What's the demographic breakout of that group? Just to at least give us some way of describing that. So we try and do what we can. We also have a section where we, present what is the recent NHANES information about variation across different population subgroups, and how has that changed over time. So we do try and speak to that, but in terms of the quantitative analyses, as Zach has discussed, it comes down to the evidence and the tools that we can utilize for that to make it a strong assessment.
Yeah, I think demographic differences in exposure risk is really important, but I'm actually talking about demographic differences in the impact of a given exposure, regardless of their exposure level. So I think that's a level of complexity that's sort of, not easy to do, but I think worth aspiring to.
Yeah.
Thanks.
Yeah, it's really interesting. I think we'll probably circle back to something at the end on that specific point. Perry?
Yes, thank you. I appreciate the excellent presentation. You've definitely addressed some of my questions, but I wanted to take a step back and ask about the role of soil. We know that if you just think about where lead in air ends up, it's mostly going to be in soil, much more than house dust, because of course there's much more surface area of the world that's basic soil. So we also know, and we have known for many years, that dust lead loading in a home is associated with the soil lead level around that home. And I assume that would be true for, pre-78 homes as well as post-78 homes when you don't have the contribution from lead and paint. We know that exterior soil is tracked in the home on shoes, etc. And we know that all of this then contributes to the child's exposure. So my question is, how come you're not looking at soil? And I get that from that figure 1, where you suggest that it's not a contributor to recent air, or recent air is not a contributor to soil. I thought that was a strange way of putting it. And given that you're using the HUD AHHS study, which has soil and housing age, how come you're not looking at that as a factor in looking at along with dust and looking at exposure? Thank you.
Yeah, I think our thinking about that is we have ambient air lead monitoring data. I think in the past, where you would have had ongoing exposure of lead and release of lead into the environment from known sources, whether it was cars or industrial facilities, at that point you definitely had fresh loading of soils. Now what you have is you have soils that are loaded, you have some entrainment, that's for sure, but whether that ambient air lead in a more generalized setting is producing ongoing loading of soil, I'm not sure that's clear. I don't know that that's as clear in a general urban context. I do agree that probably near the secondary lead smelting facility, modeling ongoing impacts to soil there is a source of uncertainty that we're not doing that. Certainly when you have elevated emissions from an actual point source, you would have fresh loading of soil. And I think that there would be concerns about that. Doing that is complex, which is an identified source of uncertainty and likely an underestimate. The one thing I will say is the delta factor approach that related air over time and indoor dust over time is probably, because it's a temporal profile trend, is capturing anything that's related temporally to indoor dust, including tracking in. So you would have some changes in outdoor soil if you have continual burials, some reductions in general soil concentrations over time. That might have been part of why you're seeing a reduction in indoor dust. But it's a good point that not looking at changes in outdoor soil is a source of uncertainty. It was in 2007. We recognize that. So it's a good point. It's going to be an underestimate in doing that.
Yeah, I was just going to add as a reminder to those that may not have been with us through the struggle we had in the 2008 review with the 2007 REA, was this idea of recognizing that lead that's in the air can conceivably hit multiple pathways. And in the past, when it was pumped into the air ad nauseum, it definitely loaded up all those pathways and had an impact. And what we found ourselves doing back in 2008 for our assessment was trying to figure out, okay, well, how do we deal with that? We know that there's some in the diet that came from the air. There's some, and so we ended up with doing estimates, and we will have estimates here of total blood lead total from all sources, where we'll use a concentration for soil and run that through our models, and that will allow us to understand, well, we know that the amount that's air related is less than that, but how much we don't know. And so before we ended up coming up with this bounding, we talked about recent and past. Our administrator made a joke about, French blue part, I don't remember, different part to past perfect, it got very complicated. And so you've hit a place that we've spent a lot of time thinking and haven't come up with the ideal solution for, except that in our uncertainty characterization, it will definitely be recognized, and we'll try and give a sense of what we're doing here is based on recent air, so to speak, air lead that's coming in, loading soil. We know there's air lead that's depositing on outdoor soil, but it may not be affecting the concentration of that outdoor soil just because of the history of the outdoor soil. And we can't figure out a way to tease that out. So maybe that just gives you a little insight into our angst over the issue, but we recognize it. Thanks.
I understand the complexity, but I guess just in terms of one thing you said that just struck me as odd, and it's on that figure 1, which is if you're saying that airborne lead is actively impacting interior soil, interior dust, then it has to also be actively impacting exterior soil. You can't say it's not current or not.
The one difference, though, I agree with you, but the one point I'll make too is you have a dynamic state a little more in the house, depending on your house, where
Okay.
you're cleaning it, you're vacuuming, obviously, you know, the
Okay.
hard surface floors, all that stuff, but you have an ongoing system where there is a removal
Removal,
process. And outdoors, you know, are you having a continuing ongoing loading? Do we now have in a general urban context sort of a sink that's sitting there that's being slowly covered by surface soil that's actually cleaner? Is it being loaded fresh? It's more complicated. In the house, you clean and you have a loading through that. At least that's, I'm waving my hands because it's a modeling, it's an empirical conceptual thing that obviously folks have questions about, and I agree, but that is an aspect of the exposure that's, I think, a little different. The conditions of the house versus the soil could be somewhat different.
Thank you.
Okay, Brisa.
Thank you for the presentation. I think it really helped to clarify the written material. Along the lines of clarification, I think it would be really valuable to further contextualize the study site selection. So I'm kind of echoing some of Susan's comments earlier. It was clear during the presentation that you're much more interested in a neighborhood that is at a standard, close to the standard. And I think fleshing out why that is important would be very valuable, because I think that, you know, this panel is about is protecting those more vulnerable. So to me, it would have sounded like you wanted to pick a site where the exposures are actually higher than at standard, so I think fleshing that out would be important. I think it would also be very important to characterize the population in Minneapolis, St. Paul, in comparison to other sites that you could have selected. And you know, here, even though, you know, we don't have all the information for the lead IQ response by modifiers, you could at least see, you know, based on like BRFSS data or other data sources, what are the characteristics of this site in terms of even dietary factors or other vulnerability factors, to further contextualize the findings that you have in this more realistic scenario, census data and so forth. And it would be, I think, also useful to have some comparisons of other areas using some of those same data. So it kind of builds a little bit on that aspirational goal, even just at a very beginner stage with the data that are available.
Thank you.
And I just, before you answer that, can I just tack on an addendum to Brisa's comment? Because I was thinking some of the same in terms of the selection of the case study sites and the scenarios here. It does seem that the approach was to sort of try to address prominently the conditions that are meeting the current or just meeting the current standard or clear, and then alternative standards. So in my mind, first, there's Brisa's question about maybe like looking at areas that are above the standard, but it wasn't entirely clear what the other potential alternative standards that might be addressed with the selection of this case study area would be as well. To me, in terms of incorporating uncertainty and addressing issues that have been raised by my colleagues as well, that's where those lower bounds, those lower design values, which correspond to lower levels of a standard, might be addressed. So yeah, how happy are you with this in terms of being able to sort of address this range of different potential levels of the NAAQS here?
Right. Just to clarify one thing, since the focus is on reviewing the NACs and considering potential alternatives, that was why we focused on picking an area where the air quality was already essentially just meeting the NACs, because then there would be less uncertainty in assessing risk for that. We wouldn't have to roll down or adjust the air quality from a higher concentration to be the NACs, and then there'd be some uncertainty with whatever approach we use to do that. We said, let's find a place where we're essentially almost there, and then the adjustment is much smaller, and therefore the associated uncertainty is smaller. And so I think in this area, the design value for the base was about 0.14, so it's slightly below the NACs. So we'll end up doing a roll up to the NACs, and then we'll probably roll down to a couple of alternatives as well. So I think that's generally the plan, to make sure that we cover some options there.
I didn't mean to speak over Brisa's other points that she made, but yeah.
Is that good? Yeah, no, the other points were great. I think characterizing the study area and how it fits into the context of other urban areas, those are important things to do in the REA write-up for sure.
All right, Mark.
Yeah, maybe 2 points, I guess. One just relates to the specific question about the approach to assigning ambient air. And by the way, also I second all the thank you for the presentation. It's definitely clarifying and understanding what's going on. But so my first point was regarding that, and I guess this picks up on, I forget who made the point about why use air mod near the point source, but not outside it. But I guess unless I missed something, I guess I am a little confused. I don't know these decent polygons. I'm not used to that kind of a thing, but I know when we deal with ambient air levels, we're usually going beyond that. I mean, at the very least, sort of averaging nearest monitors or Kriegging or something even more sophisticated. I mean, there's all sorts of different approaches in there. So I'm sort of wondering why those aren't used. I would have thought they wouldn't be that hard to implement.
Yeah. Or do you want me to address that very quickly?
First, and then I'll.
Yeah. So let me just be very. I think the point to keep in mind is that those surrounding, ambient monitors do have some gradient, but that gradient at 0.01 or 0.02 is so far below the NACs level that we're interested in, that giving sort of population representative picture of distributions in ambient air there, the sliver of air-related risk relative to other risk from other pathways is going to be very, very low in those ambient levels. So when we go, we'll generate that. But let's say that you're talking about somewhere between 0.01 and 0.03. You have a gradient there, it's true, but that gradient is nearly an order of magnitude below sort of where we're asking questions, and getting a lot of spatial precision and trying to interpolate that it's sort of like getting spatial resolution on the valley when we're interested really in this sort of peak impact exposure. So I mean, that would be the question. That would be the point that I would make.
Which is why.
And so like with PM 2.5 or something like that, which I've worked on too on the benefits analysis side. Of course, we want to do really comprehensive characterizations of these surfaces, because much more of the area is often you have a more complex surface, and you're really interested in looking at this interface of steep climbs and slopes, that you're seeing. And so you're doing various methods like you're talking about that I think make a lot of sense here. I think from a policy standpoint, keeping in mind that air focus, it allowed us to say these are all fairly low relative to the current NACs, and we will get a picture of risk for that broader perspective. And let's say that when we model a 0.01 to 0.03, what we saw were very policy relevant risks of interest, then you could say, let's get a better characterization of the demographic profile in that more generalized part of the city. You might ask that question, and certainly that would be part of the picture that would come out in our urban characterization.
Yeah, but really we focus
in those lower areas, though, are they contributing to your your calculation of how the air lead relates to the dust lead? I mean, maybe the fluctuation is so small that it really doesn't matter, but presumably they are contributing to your assessment of how air relates to dust.
It will, and you're going to have a fraction of air-related risk compared to total exposure and risk for those children. And what I'm saying is I think you're going to see that that's going to be a relatively small percentile policy-wise, and getting a lot of precision relative to the risk you're going to see for the kids living closer to near the source and at the standard, and taking, let's say it's, I don't know, we're running the risk numbers. I don't know what it is, but let's say it's 10% of the total risk or something like that. Getting a lot of refinement in that 10% layer is not as important, I would argue, as getting a picture when, I don't want to use numbers because I don't know what they are yet, we're still running them, but when the air-related risk near the current NACs for kids in those isoplex that are higher is very policy relevant. The air is a significant contributor. I'm not the administrator, I don't make those decisions, but is a more substantial quantitative picture of exposure and risk. So if that layer, the contribution for the vast majority of kids being represented by those area source monitors is relatively low, getting a lot of precision in that ribbon of exposure is not critical. You could do it, we could spend a lot of time there, but I would argue it's not value of information to use that metric. And whether we have the kernels or the kriging, it's been a while since I've done that, to actually run that given those sparse patterns and relatively low variation in the annual average, annual average,
right,
is a question.
Okay. So my other point was, and I mean, this document wasn't actually dealing with the step of getting to the kid's blood, but I do want to come back a little bit to, I think Bruce and Brian were hitting on this the most. I think I'm getting a little bit. I mean, you want to focus on houses that are built after 77, so you can really focus just on the lead, on the air part. In the houses, there's sort of cleaning processes, so it's new. Whatever's there in the dust presumably has come from the air. And that's why, responding to Perry, you're sort of don't want to consider the soil, but that you still have, I mean, even that air, some of the air is going out of the soil that's coming in from the soil into the house, into the dust. So there are, pathways here that are bringing it in that then get missed. And I still come back to this issue of, if we're really going air lead to home dust to blood lead level, there's a lot of steps in there that can sort of introduce uncertainty, and I don't know what can happen. And I'm still struggling with why one wouldn't try and do what sort of I think Bruce was saying and Brian, going right from the air to the blood. Now, I mean, the issue of the housing, I mean, you could pick bloods from kids who were in newer houses, so they're not subjected to the paint, right? And just get a direct assessment there. So I don't know whether this is going to be more of a discussion, but I'm still struggling a little bit to see why that wouldn't be a more direct approach. But
and just to make sure you understood, Dr. Weisskopf, we do always look at the studies, the publications on air concentration, blood lead relationships, and those were summarized the most recent in the ISA. The PA will discuss those and consider what do they tell us about that relationship, and we'll try to calculate a relationship of air to kids' blood from the quantitative risk assessment that Zach is leading. So we'll be able to look at those too. I think from the studies that I remember that we have for air to blood, I don't think any of them are focused based on age of housing. They're usually a population of kids in an area where maybe you could make some judgment about how old you think those houses are, but there's probably a range. And there's uncertainty there for a number of reasons, that the sources are all over the map. But we do utilize that data set as well, is my point. It's a different calculation. It's in what we call the evidence-based considerations in the policy assessment. And just for backdrop, I think you may, were you in that 2000? I can't remember. You were on the last lead panel. I can't remember the one before. But when the standard was changed back in 2008, the administrator looked to both types of analyses in making judgments. Both, what did we get out of the quantitative risk assessment, which was hugely complex with associated uncertainty, as everyone recognizes, and what can we get from looking at evidence-based analyses, recognizing the uncertainties or the limitations with the data or the studies that were done and the associated uncertainties there. So you had two different things, each with their own set of uncertainties, and they both informed that decision back in 2008. Likely they will both inform again as they did in retaining the standard in 2016.
And in an ideal world, if there was a regression relationship that was done where they had age of housing, air, drinking water, I mean, they had the whole sort of predictors of blood lead, and I think whether that's ongoing work that folks are doing, I think that would be awesome to do. I mean, if we could have a model that would put these factors together and predict it, I think it would be very useful. I think certainly if we had that, it would be interesting. I think the one point I would make about the paint lead, and I certainly, that second step that I had the plot, that we showed the plot of going from dust sled loading to concentration. It is another uncertain element. It's definitely one. It's highly nonlinear. And so if we add, like if we deal with an old house and we have paint dust loading, that puts you on a flatter part of the response curve and going from loading to concentration. And that means a unit of air loading is going to have less contribution to dust concentration because you're on a flatter part of the curve. And so in terms of asking what policy, and I could see people on the call going, that's why there's all of this uncertainty. What are you talking about? But it's like in 2007, when we were looking at IQ loss and we were dealing with a nonlinear concentration response function, a steeper slope early on. If you dealt with a more complete, treatment of blood lead, including old housing, let's say, and it put that child on the flatter part of the concentration response function, and then you ask what a unit change in air is doing, because you're on that flatter part of the curve, you actually have a policy smaller effect on IQ and blood lead. And there would be a similar case here. If we were dealing and we tried to model old housing, if we did it with our approach, given it's complex, and I hear that criticism totally, but in going from loading to concentration, there's a highly nonlinear function. I always forget concave, convex, I have to look at it and draw it out. But you're going to be on a flatter part of the curve. So the air-related contribution to dust lead is going to have a smaller policy impact than looking at a situation where it's just air that's loading it and you're on a nice steeper part of that loading the concentration curve. The nonlinearities become
right. No, I get that, but I mean, I guess my two responses to that would be that that's my point is, you could do the blood one, and I don't see why, if you know where people live, you could target people who are in newer houses, so you pull that out. But the second is apply a nonlinear function to it, so that you know that, because you're going to get people with blood ranges all over the place, so you can determine what it is at the different ranges.
So our modeling includes, I guess we have the nonlinearities in that model, and what I'm saying is, that's why I focus on air-related exposure alone gets a higher policy hit for that air-related impact. That's my point. And if you factor in other sources of exposure, you push those kids out on a curve that's actually flatter for a change in exposure, and which argues about the uncertainties and the complexities. And I hear that. But in an ideal world, we would have the regression you're talking about, the empirical relationship. I think would be an excellent one if we had it.
Okay. Brian.
Zach and Deirdre, in trying to understand the relations between soil lead, air lead, surface lead, and child blood lead levels, can anything be learned by looking at cities, for example, like Philadelphia, that had these old legacy lead smelters in the city? And then when those areas of the city were gentrified, they saw significant increases in blood lead levels in children in those neighborhoods. There's a lot of East Coast cities that have these legacy lead smelting sites, and a city like Philadelphia, I'm not sure about this point, but might have more of the race and ethnic and SES diversity than Minneapolis, St. Paul. I'm not sure about that point, but I'd be interested if you've thought about that. Thanks.
I think, that makes a lot of sense to look at patterns of changes in media concentrations over time in blood lead and seeing whether, I don't think we've missed the research if that had been done. I think the pattern you're talking about is interesting from a research standpoint. Looking at trying to relate these things over time. Certainly in the factor-based model that we used, we were using available data on the dust collection. If we can, if there's a study that uses those data in a more focused analysis of a location, like you're saying, I think would be interesting. I might be concerned about levels that are not as relevant now, given the ambient air levels we're looking at. Part of what happens is there was a lot of work done when levels were higher, and now we're dealing with the levels that are relatively lower. And if there are nonlinearities, you want to be careful about using a study that may have been focused. That's why there's regressions early on when I was giving the presentation. I said we had relationships between air and dust concentration, and those had come from smelter sites that were higher, and gave us nice relationships, but they were obviously sort of up here and not where we are now. So that's a good point.
So just so I'm clear, you at EPA will put in your models published parameters, but you won't do any analysis with new data. For example, you have air monitors in Philadelphia, you have blood lead levels in Philadelphia, you probably have information on soil, maybe surface. So you only use published parameters, you don't do any original analysis?
That's correct. I mean, it would need to be peer reviewed and come through the ISA, right? I mean, the ISA provides the record for the review.
I mean, that delta factor approach is a very, very crude, simplistic, quick thing that we did because we thought we could and get something that would be informed,
studies, yeah.
and and it was based on published data. But yeah, I mean, I think the answer.
And that's one reason that the delta factor approach relied on medians, because we did not have the raw data and wouldn't be able to utilize it. We were relying on what was published.
Didn't have the address data for the houses.
Thanks.
Go ahead, Phil.
I wanted to come back to the what I think of as a constraint of the annual average. And my understanding of sort of the history behind that and the IUBK model is that it's twofold. One is sort of the development of the IUBK model on a 1-year age group time step, not the kinetics part, but the actual exposure aspect. And a lot of the, at the time, I think exposure factors that we felt were drivers, things like soil and dust ingestion rate, were limited in terms of how finally we could break that down. So I think over time, there's been this understanding that a 1-year average sort of makes sense when you are using the IUBK model. Now we have the all ages led model that kind of relaxes that constraint. We have the ability to model intermittent exposures. If we were limiting ourselves, I think just to kind of trying to understand outdoor soil and indoor dust concentrations, again, I think soil and dust ingestion rates only allow us to go down so far. But it strikes me that the air monitoring data, particularly in the case studies, gives us at least reasons to think about a sensitivity analysis on the decision to generate annual averages. Certainly, we can use lots of different ways. We can look at quarterly averages and what have you. So I was interested in if you could help us understand a little bit more how your team has thought through the potential utility of considering a shorter time frame than an annual average as a way to walk through the sequence of steps to get to a predicted indoor.
You just went mute. You just muted. Well, you just went out.
Oh,
yeah, like the last sentence. Yeah, there you are. You're back, I think.
Okay. So yeah, could you help me understand a little bit more what your team or your views are on whether there's actually some utility in exploring shorter timeframes?
I mean, the way I think about this is sort of you go through each piece, and whether the dust sled modeling that we're doing, the way we're doing it, granted with some of the criticism we've heard, I'm open to those, or constructive feedback. What's the time step for dust sled modeling that we could do? But the bigger question, I think, is on the concentration response function. Given that we're looking at IQ loss, one of our focuses was to make sure that we were trying to identify lower exposure response functions that covered blood lead levels at lower levels. So we're using published subsets of the data that had CR functions below 10 microgram per deciliter. But the other issue is going to be the time frame. I mean, those concentration response, the EPI studies, reflect fairly broad measurements that. So I guess the other way of thinking about it, going other way, is taking a more refined estimate of blood lead, even if we could generate that with dust modeling element. How would we translate that into a quantitative health endpoint? To what does it mean from a public health standpoint? That question, and I think that's where the limitation would be.
Yeah, and I'll just add, you mentioned that you recognized issues of annual time step for dust and soil, but perhaps air. And I would say, I mean, air is the small piece of the exposure. I mean, when it comes to lead, it's the inhalation pathway. We model it, but based on what we've done in the past, that's not a large percentage of where the kid is going to get their air-related lead. They're going to get most of their air-related lead from that dust pathway. I mean, that's the way it's come out before. And so, yeah, I mean, if we could easily do a sensitivity analysis, feeding, smaller increments of air concentration and seeing what that did, that certainly sounds like an interesting thing to do. We have focused on the IUBK for a variety of reasons having to do with, I think, model evaluation and things.
Well, I can talk a little
as well, but it's good feedback.
Yeah, no, just clear. I wasn't specifically thinking about the inhalation exposure itself. I was thinking about the drawing data from air monitor, for the case studies, you have air monitoring data and you've annualized that, so it mutes it. There certainly might be quarters where it's higher or lower, which would introduce more variation in the ultimate prediction of the concentration indoors. So rather than it being a muted average, you would have the ability to represent that variation in the concentrations in the indoor environment. And that could be relevant in certain conditions, I would think, where you might have extreme spikes from the air monitoring results, but you wouldn't see that in the annual average. And so what you end up with is perhaps an artificially lower muted indoor environment than truly exists.
Yeah, and that's going to reflect obviously the dust sled modeling, which is complicated. I mean, the compartmental model effective, if you're solving for steady state conditions, at what point does that exist? I have to look back to see where we think that's occurring. It's and the cleaning frequencies, the range of factors like that. Yeah. I'm not selling this for being a simple, tractable model at all. It is complicated, and I'm reminded of the surface types that Dr. Lanfear, had raised. I mean, these issues are all relevant. We're definitely very aware of a lot of those issues here and how those tails can wag. It's like a dog with 50 tails. It can be wagged in many different directions by these different parameters. But the temporal precision of our ability to model this, I think is questionable. But I take the point that you could have a month that's high, and there've been concerns raised about blood lead variability and blood lead monitoring. I realize that, and that's occurring for a reason. Is it flushing? Is it water? Drinking water variation seasonally? The other things that have been seen, I'm somewhat aware of. So I know that's an issue. But then again, I would also say, in sort of the what does that mean from a public health standpoint? That becomes a question, I think, for the EPI on a research standpoint. Can we tease out some relationship between an endpoint and these concerns? Temporality.
Okay. Bruce, I'm going to get to you in a second. I'm kind of noticing, probably because the two topics, because of their inherently interrelated, that there is a little bleeding from one topic to the next, and it probably was a bad idea on my part to try to separate them. So if anyone has any questions, that they want to kind of bring up, I think that's fine. We can also take a short break too after Bruce asks his question. I think we're covering a good deal of ground here, but yeah, maybe it was a bit arbitrary to separate it by topic. So, Bruce, please.
Yeah, maybe a comment and then a question. The comment is, I probably over the last 15 or more years made a series of recommendations about the EPA conducting epidemiologic studies to enhance their ability to protect the public. And I didn't know that you guys don't do your own research. That is like
hang on.
No. We're not speaking for all of EPA's research program. We are speaking for doing a quantitative risk assessment to support a NAAQS decision. Those are two very different. EPA has a huge research program, as you must be aware and are familiar with, Dr. Lanfear.
Well, I thought so, but every time I've raised a question about we need to go out and do a study so we have ways to validate some of the assumptions built into these mechanistic models, nothing seems to happen. And so even if there are other branches doing the work, they may not be doing some of the specific work that needs to be done. And that just, it kind of comes to me sort of as this, why have I been so stupid? Because I assumed that you were. For example, in one of my comments, I pointed out that there is a study that has a lot of the variables you're looking at: air lead, dust lead loading, blood lead levels, mouthing behaviors, breastfeeding, any number of other things that could be used to help answer some of the questions. Now, there are some limitations. It's pre-1978, but we've got all the measures that we're concerned about. And there's a lot of 1960, even 1950 to 1978 housing that doesn't contain much lead. So there's some data out there that could be used that's already been collected. And why is it that some of those data aren't being used to help make sure that the standards are protecting kids? That's my comment. The question is this. I think it was Mark that was talking about what's happening at the lower levels. And I think you mentioned, well, we don't think there's a lot going on there. Well, from the standpoint of Richmond Bryan's article, there's probably a lot going on there. I think the big question for me is down to the lowest levels, whatever they are, does that represent 10% of children, or is that 90% of children? Because if it's 90% of kids, then just a little bit of exposure in a large population might be more important than heavier exposures in a small population. So I think we need to also think about the population exposed as well as the air lead level. And I'm sure you've done that. So that's the question, is how have you taken that into account?
Well, I would suggest that's one reason why we have the case studies that we've explained. We have not simply a generalized urban hypothetical situation. We also have this urban area that includes the vast majority of children living distant from a source and having much lower air concentrations in their neighborhood, so that we can look at what is across the whole urban area. What do we see in terms of the distribution of risk for that population? And then also, because what is often most relevant to decisions on the standard is what is the risk and the hazard to the children that are living very close to that source. So we have 3 different case studies, each of them looking at different circumstances and giving us different characterizations of risk for different populations. And so I think across those, we hope that we've captured what you're talking about, which is a large area where most of the kids are exposed to much, much lower air concentrations.
And so will you be providing some way to examine the attributable risk or the total number of IQ points lost, for example, in the low exposed but larger populations, as well as the more heavily exposed smaller populations? You see what I'm getting at?
We'll look at the risk to all those children.
I mean, I think at least in the past, and we're open to observations and suggestions on the risk metric, very critical point. We have tended to characterize 50th percentile median, high-end 95th percentile risk levels. So what is a typical child? What is a high-end child near the secondary? I'm not going to mention the facility, sorry. Near the secondary lead smelter, what's the 50th and 95th percentile? What's the 50th and 95th percentile risk and exposure for the broad set of kids that are out in the wider Minneapolis-St. Paul area? Those are point estimates of individual level risk characterizations. That tends to be when we talk about public health protection, at least my experience so far in the kind of work we do is we focus on that magnitude of individual risk at various points in the distribution. When I think about rolling up statistical incidence of IQ points lost, I tend to, in the past, that's been traditionally done as part of a regulatory impact analysis, benefit analysis, where you're doing evaluation. I think we tend to ask, is something protective or is it not? That is a question, at least in my experience so far, has been asked of an average and a high-end child. What is the individual magnitude of risk? When you talk about statistical counts of deaths or certainly something like aggregated IQ points across the population, so far that's tended to be more of what we do in a benefit analysis, where you're right, that you may have the much greater quantified statistical incidence being in a lower, more lowly exposed, lesser exposed, broader population.
I'm sorry, I couldn't hear you. Zach, you were saying you typically, the population attributable risk, which is I think what Bruce is getting at, right? You tend to do that in what context?
So we tend, you're talking about like a total estimate of statistical IQ points lost for a larger population, that tends to be a calculation that's done more as part of the benefits analysis, a regulatory impact analysis, because you're valuing a total aggregation of IQ points from a public health standpoint, monetarily, dollar-wise. In a risk analysis supporting NACs, at least it's been my experience so far working on these, even frankly for the mercury power plant analysis, which I did both the benefits analysis and the risk assessment. The risk assessment asks public health protection in terms of an average and a high-end child. You know, what are we looking at in terms of risk to a child? IQ points lost, you know, other endpoints. Population attributable, statistical incidence, whatever we want to call it, that tends to be part of the benefits analysis.
Yeah, we look in the NAC's decision making. The question to the administrator under the Clean Air Act is protecting the at-risk populations. And so, what is the risk to the at-risk populations? And so that's what it doesn't do this hypothetical calculation of IQ points as if they're taken away from the child. I mean, you know, and put in a pot separate from the child.
Okay, Kathleen, you have your hand up.
Okay, I just have a question. In your analysis, alternative exposure conditions, do you look at the impact of smaller particles versus larger particles? Because I mean, not just air concentration. In other words, if you had equal air concentrations of small particles versus larger particles, there's so many different things that smaller particles are more efficient at in getting to the blood. So I just was wondering if you consider that.
I should just note that Susan and Deborah also made similar comments in their individual submitted comments.
So I'll speak to that on the modeling side. I know that's a huge issue for getting the dust loading from ambient air. So aside from the biokinetics of it, particle size has a lot to do with penetration efficiency, deposition velocity, all that kind of stuff. And that's a huge topic. It folds in with uncertainty, frankly, in our modeling. Again, talking about the complexity of this model, start to feel really defensive about that, but it's true. So that would be an issue that I think we would talk about within the context of uncertainty characterization, the dust modeling approach. On the biokinetics and absorption, I'm not as familiar with how we might treat that. We would talk about that, I think. Deidre, you might want to.
Sorry, it's in the IUBK model. There's some parameterization that gets at that. But the bottom line is we don't run individual particles. Right. So there's sort of an assumption that you have lead, and we know that lead is particle bound, and we know there's a distribution of particle size, but we don't know what it is in every instance. And so the IUBK model is going to take the lead concentration in the different inputs, and it's going to run them through the biokinetic model. The air concentration that goes into IUBK, one of the parameters has to do with absorption coefficient, I believe, is in IUBK, and we set that based on historical data about distributions of particle size. I mean, so that's a place where we have considered it, and we updated that parameter actually back in the 2007 review based on modeling. Jim Brown from ORD, we did a lot of the work on that. So to the extent we can, we try to, address the issue of particle size, but frankly, the data aren't there, and the model and everything else to try and tease out how a lead on this size particle might operate through into dust and from dust to kids, et cetera.
Okay, well, just a follow-on comment, I guess, is that at lower air concentrations, the smaller particles you might see more a more efficient absorption to blood, not just from the inhalation, but also just the fact that there's potentially a lower level of lead in blood, so there's more efficient uptake from the blood itself at those lower levels, which.
Yep.
Right. Okay. Anybody else have comments on either of the charge questions? Chris.
Do you want to take a break or no?
That's a good question. Okay, by a show of hands, how many of you would like a 5-minute break?
a 5-minute break versus ending 5 minutes earlier on a Friday afternoon?
Well,
Or 20 minutes.
some of you may want to end now, but all right. Why don't we take a 5-minute break at this point, and then we'll come back and we'll finish with the other individual questions and comments.
Okay, just a short announcement. We will have additional clarifying comments from the public period after the panel deliberations. So just want to remind members of the public regarding that. If you are interested, please email me at yao.aaron@epa.gov. Okay, so we'll take a 5-minute break. We'll come back at 3:40 and we'll put, 3:41, and we will put up a timer on the screen as well. Thank you.
Okay, we're back, everybody. Now, Chris, I assume that you have a comment and that you specifically wanted everybody to take a break because this is going to be a bombshell comment that you're about to make, or no?
No, I wish I had a bombshell, but no, I just wanted to make sure we got a break if people wanted it. So I'm grateful for the break. So can I go ahead? Yeah. Okay. So I'll join the chorus of thank yous for the presentation today, as well as the decision to consult with the group on these questions. With regard to the modeling, the hybrid modeling approach, I had a couple comments and questions. First, on the mechanistic model, your decision to not use the factor model, the two-factor model, I thought made a ton of sense. There's just too many, I think, drawbacks for that. But the revisions that you made to the mechanistic model, and I'm looking at the report here. You said that I'm sorry, I'm kind of flipping between here. Okay, you said that the updated that new data are available for, and you mentioned 4 of factors in that mechanistic model: the air exchange rate, deposition rate, cleaning efficiency, and cleaning frequency. And it says details will be presented in the REA, and you referred to that in your talk. And I mean, okay. As I think through this, there's 2 reasons that you could update these parameters for the model. One is that there are better values now than you had 17 years ago or 18 years ago. The other is that these things have changed over time. And as I think through this, I can imagine that, American homes nowadays may be better insulated and better sealed. And so a factor like air exchange rate might in fact be lower now than it might have been 15 or 20 years ago. And that would affect this calculation. But the other factors, deposition rate, cleaning efficiency, cleaning frequency, wouldn't seem to be likely to have changed. So to what extent are your new data the result of what you believe to be better estimates out there in the literature? And to what extent do you think that they're because these PAC factors have changed over time?
So I'll say that, we have updated data and a number of those, and then really doing a second look at how we interpreted the data. There's a lot of calls to be made, and we'll lay that out obviously in rationale and a lot of explanation in the REA, and I'm not really prepared yet to do that here. But as a team, working with the contractor that we work with, who has a lot of experience and has done a lot of support on other offices on dust slide and other things, it's a combination of having new data, updated data, and then sort of taking a fresh look and interpreting things. So it's a combination of both. And in the past, there was professional judgment that was made. Sometimes we found better data for some of these parameters and could base that on newer information that still involved interpretation. There's a huge amount of variation in these parameters across houses, across regions of the country, across house makeup, carpeted floor. I mean, there was a huge amount of complexity in trying to come up with sort of a representative parameterization for an average house is not easy, and is clearly something that from a sensitivity analysis is an important thing to do. Look at what it means to run different sensitivities with different choices, because it's not, even when we say we want to have a parameterization of the model that we use, which we are here, if you took that model and you did it for different parts of the country, for different houses, I'm now repeating myself, you would have this parameterization being different. And so there's a lot of complexity again there, and there's uncertainty associated with trying to have a representative take on the model. That's for sure.
And those are things that'll get laid out in the uncertainty characterization with sensitivity analyses done on key input parameters, so that we'll be able to see the influence of those and characterize uncertainty as we do in all of these assessments.
Okay, so I mean that's fine, and the drop in that coefficient was about 25%, which does have a pretty substantial impact. But when you look at Figure 9, I think it's Figure 9 in your report, but you presented in your paper in your presentation as well. It's the graph showing the overall modeling result as a function of air concentration. And when you look at that, it's pretty clear that the choice of the second model is a lot more important than the choice in the first model. Not to say that the first model isn't important, but there's the two the two lines that are way up here, which are from using the Bevington model, and then there's the two lines down here, which are from using the existing your existing model.
Stage. Right.
And as I looked at that graph and thought through the justification that you used in the report, I didn't feel like the points you made in justifying continuing to use that 2007 model made a lot of sense to me. And I just the Bevington study I thought was well done, and I think they were pretty comprehensive in what they did. And it just seems to me like, I don't know, maybe a closer look at how you might either use one of those equations or maybe use the data to come up with a better estimate on your own. I'm sure those data are publicly available. Would be warranted.
So, and what I'll say is we are very open. This is why we come to you folks, is to get feedback, particularly perspectives on model choices. If we've laid out a couple of options and we've sort of presented, our thoughts, and I don't necessarily get myself in trouble. This is my take on this. I don't necessarily think that any one of these is a sure winner thing. And it's very reasonable to we want input from you folks. And if you take a look at in a modeling element and you think, look, I think this is just as defensible as the other one, maybe there ought to be a range reflected across these things. Maybe drop one or include the other or whatever. I think that's part of our hope, is that we've fleshed out or laid out the information reasonably to get feedback from you folks. And I know that it's, in some ways, we said we'll show you some of the information when we do in the REA, but to the extent to which something like this, you feel that we should be considering one, weighing it however you feel is credible, we're definitely open to that feedback. That range, yeah. I mean, I think that, yeah.
Well, and in particular, one of the things that I thought a lot about was what was considered to be a weakness of one of the source data sets for the Bevington study, which was the Canadian data, which included data from the wintertime only. And I understand why that might be considered to be a bit of a weakness, but I would think that would be, well, a couple things. First of all, there must be a way to overcome that from an analytical point of view. But secondly, in a place like Minnesota, the exposure is probably much greater in the winter anyway, because people spend so much more time indoors in the fall, winter, spring than they do perhaps in the summer because of the climate. So anyway, those are just a couple of other considerations.
Yeah, my head gets spinning on that Canadian study. That could be conversations from different dimensions of that, because, to what extent do you have general dustiness, like total dust being constrained, which results in a higher concentration because, of course, you dilute out lead loading going to concentration when you have greater dust. Part of the complexity I think that a number of folks on the call have made is this loading to concentration conversion is a very complicated factor, because there's a relationship between the lead loading and the total dust loading. And these things go counter to each other in some ways. When you talk about concentration, it becomes very complicated. You sort of have that dilution effect or inverse dilution effect, depending on what's happening with general dust versus the lead source. And that can be a really critical point. So, yeah.
Hey, Brian.
Thanks. Deirdre and Zach, I was curious why you didn't try to harmonize your exposure and dose exercise sort of with the Canfield paper. They measured blood lead every 6 months to 5 years, and you're doing annual averages to 6 years. And then you're going to use your estimates with their parameters that were different?
No, I think the 6 years is simply that we want to identify the children in the study area that are 6 years and less, and we're going to model blood leads less than 6 years, because the oldest one is Canfield has a relationship that he explored with regard to 5-year-old kids, right? He has, and so we will, for the Canfield concentration response function, we'll use a 5-year-old blood lead. For the other study, which is Bellinger from the Boston cohort, it's a 24-month blood lead. So we'll take two outputs from our IUBK model to marry them with the concentration response functions, one at 24 months and one at 5 years. So we hope to be, our intention is to match up, sync things up properly.
And then how about the 6 months versus 1 year?
So I'm not sure what you're referring to on the 6 months.
They measured blood lead
They
every 6 months.
measured, well, sure, those cohorts, all of them have blood lead measurements 6 month, 1 year, 18, 24, all the way up. But the concentration response relationship, the IQ response blood lead relationship, they focused on specific blood lead measurements. And exactly. And so it was blood lead at 5 year and IQ at 5 year in the Canfield study. In the Bellinger study, it was blood lead at 24 months and IQ at 10 years, I believe. And so it's that marriage, that's what their concentration response functions are. And so we're going to feed, we're going to use our outputs from the IUBK for 24 months, apply it with the Bellinger, and then for 5 years, apply it with the Canfield CR function.
And sometimes they would take different CR functions for different blood lead metrics relating for IQ loss in different studies. I'd have to look back to see, but I think we chose the ones that had the steepest slope. Or the highest,
strongest,
best fit.
Strongest relationship.
Right, the strongest relationship.
Susan?
Yeah, thanks. I wanted to go back to something that I think is relevant to what we talked about before the break. We had talked before about whether the filters that are used typically for air lead measures can be used for nanoparticle size lead, and I think we were going to revisit that. And I'm just curious if there's a simple way to think about that, and if there's an answer to it, because I think it has implications for, questions about particle size distribution, and even, the traditional information that suggests that the vast majority of air lead exposure to children occurs through dust and ingestion as opposed to inhalation. But I just want to think about whether that could in any way be an artifact of how we're monitoring air lead.
And thanks, Susan. I think that was Bruce's comment when I kind of cut him off earlier in the meeting. And I think George, who has been unusually quiet this meeting, has something that he wants to say specifically about this. So
okay, yeah.
See if I can get my mic. Yeah, you're right. I've been unusually quiet. I'm a little under the weather, but this is related to the comments that Ms. Barnes made earlier today. I read through them and I took a look, and there's some confusion. The filters used in high vol monitoring are fine for the intended purpose. The 1.6 micron is the pore size, not the end of the filtration range. You look at the specs in the Part 50 regs, and it's the usual 0.3 micron, 99% DOP test, which is very common for most filtration media. As you go smaller, larger particles, you have mechanical impaction removal. As you go below 0.3 microns, you get van der Waals forces, not mechanical forces, start to dominate the removal. And they're very good at removing small particles. Mind you, there's very little mass at 4 nanometers. The mass is mostly in the particles much higher than that. So in short, although I absolutely agree with the commenter that airport lead is a major, major problem and EPA really, really, really should do something about it along with FAA, the filtration issues with the measurements made by high vols, in my opinion, is not an issue. And Judy can pipe up if I got that wrong. Thanks.
Yeah, George is right that people often confuse with the pore size of filter with collection efficiency. And most of the filter, EPA doesn't test every batch of filter. From time to time, that all the reported value is over 99.9% in terms of capture. So there's a size distribution, and George explained it well in terms of different mechanisms. So as far as I read the public comment, as far as that for the filter, can they capture nanoparticle? The answer is yes.
thank you. Bruce.
Well, I find that intriguing because what that means is, let's take Reed Hillview for a moment. Reed Hillview Airport had no problem with air lead levels, right? The monitors didn't pick up very much lead. And yet, what we found was that the children who lived close by had quite extensive exposure. And so we've got now this situation where the monitors are picking up, presumably, based on the comments, the lead from the aircraft emissions, but they're not showing there's a problem relative to the standard. But children's blood lead levels are increasing in ways that are quite important. We found that as the air traffic increased, blood lead levels increased quite a bit. So about 10% of kids exceeded 3.5 microgram per deciliter, or 35 parts per billion. And yet, apparently, there wasn't very much problem with lead in the aircraft emissions because it wasn't picked up by the monitors. So how do we interpret that?
Are you asking us?
Well, well, George and
Oh, sorry.
Judy would be fine too. But it just seems there's a mismatch.
It's a whole other
Or
topic.
maybe the standard is just completely inadequate to protect children.
And that was going to be my comment, is if you're referencing to the standard, you can still have exposures that can cause elevated blood levels from local GA aircraft. But I really think the monitoring, at least the physical filtration part of the monitoring, isn't an issue. You can argue high vols have issues. You can argue that maybe they're in the wrong place, ... But the actual measurement method per se, I don't think is an issue here.
Okay. Bruce, do you want to follow up with anything or no? Or are you okay?
No. I mean, I'd like to just maybe emphasize that point because I think it's important, but we should circle back to it and not lose track of it, because I think it's, along with a couple of other studies, really points to the problem that the existing lead NACS is not adequately protecting population.
Thank you. That was what I was trying to get at earlier about the efficiency of small particle emissions and how they, the air concentration might be quite low, but the actual absorption into blood might be quite a bit, greater. So maybe that's part of the equation.
Yeah, and that fits with Richmond Bryant's analysis, where you see that steep increase in blood lead as at the lowest levels. That's where you see the steepest rise. And so maybe it shouldn't be a surprise.
That's a huge issue that you're raising. I think that we probably will circle back when discussing the policy assessment and some of the evidence-based work too, which, certainly has informed this NACS process, but other NACS pollutants as well. But yeah, I do hope we circle back to that. Yeah. Perry?
Yes, my question's on the other end of the scale, the large size particulates. I know we learned during this process that EPA has many more PM 2.5 monitors than total lead monitors, and you were using both data. In the study area, are all of the monitors on the map, are those all total lead, or are some of them 2.5? And how would that impact these measurements?
They're all TSP. They're all lead and TSP.
Thank you.
The lead in the lead in PM2.5 monitor would not be relevant for consideration against the NACS because it's only a small portion of the lead in air.
Susan.
Yeah, I appreciate that some of these issues that we've been talking about are policy assessment related, but I do think that in terms of identifying uncertainties with the modeling process, I think it's probably not unreasonable to consider uncertainty regarding the relationship of filter lead measures to blood lead. The the relationship is a little unclear because it doesn't take into account the potential for differential bioavailability of different fractions of the lead. And I think that as different sources of lead exposure shift over time and potentially aviation gas becomes increasingly important, that differential bioavailability may play an important role in future risk assessments. So, I mean, we may not have enough data to address it now, but I do think it's an important limitation to acknowledge, unless I'm misunderstanding the limits of the knowledge that we currently have. If that makes sense.
That definitely makes sense. Anyone have any other comment? I actually have a comment that's kind of related to what Susan just said, but I don't want to. I want to open it up to anybody else. You know, I'd like to know more about the exposure characterization that you're planning to do. I know you had the slide and you said that you'll be kind of following the WHO approach as well as some quantitative discussions of uncertainty. It strikes me that when I was preparing for this meeting and reading all of the comments, that almost everybody pointed to a source of potential uncertainty, like as a question or concern. And I know that you're thinking about this, pretty intensely as well. I guess my question is, how I don't know enough about the WHO uncertainty characterization process or the approach. How do you intend to kind of present the sources which are highly multifactorial of uncertainty? Is this going to be a propagation of errors approach? Is it going to be a formal sensitivity analysis? Is there a way for us to sort of see the robustness of the risk assessment and, as you vary, the different input parameters that could be very highly uncertain along a range of different parameter factors here. So I know you've thought a lot about this, and there is a lot of uncertainty here. And I'd love to kind of hear about how that uncertainty will be presented formally in the risk and exposure assessment and as it relates to the policy assessment as well. So.
Sure. So, one thing we tend to do is a bounding analysis. So there can be like an elasticity analysis. I think that can be very valuable in looking at the mathematical relationship of various elements along the path. We find that a bounding analysis, where you take alternate parameterization choices and look at what that means,
right,
is something that we tend to do from a quantitative standpoint. That's one. The other thing we'll do is, depending on the degree to which we have potential bounds in key elements that can be included in presenting risk estimates as part of in sort of the core policy space. Take the CR function. We have two different CR functions. We're not going to favor one over the other. We'll run both and generate a set of risk estimates that reflect both of those CR functions in play. Part of our reason for coming to you folks is, if you look at the various dust modeling elements and you think that one is stronger, or they're both viable for step one or step two, let's say, whatever that might be, then in presenting core risk estimates, we may favor the one or choose the one for the core analysis, or include both sets of analyses and present a range to decision makers. In our experience, presenting a range is attractive as a risk assessor because it's true to the data. It becomes more challenging in policy space, of course. If you can choose a best approach, it's great. But if you can't and you need to present a range like the CR functions, we're going to do that. So there would be a range of estimates presented in the main risk tables reflecting a choice of key elements. In addition, there would be the bounding analysis, like I said, across a range of different choices. And then there would be the World Health Organization uncertainty table. The way that works is you try to characterize, and this is often informed by quantitative bounding analyses, also by professional judgment. You try to characterize the nature and magnitude of bias introduced by individual parameters or sources of uncertainty. That tends to be more, what you're trying to do is tell the decision maker, look, of the 50 elements here, these 5 are super key, and they have a big impact. They all tend to push it high or push it low, or they go in different directions. And that gives the decision maker a feel for the possible magnitude of bias reflected in uncertainty from a semi-quantitative standpoint.
Yeah, and
So
I
that's
think
sort of
that,
those three pieces of the picture they're doing.
right, and I think that it's well put, and I think it's a very reasonable approach, and that's what I was trying to kind of not very well articulate previously, which was, making sure that your approach is sufficiently capturing those lower bounds, which do incorporate, that uncertainty and creates the kind of margin of safety that's associated with, the potential errors and biases in the parameter inputs. So if you're comfortable with that, especially, it's more important that the REA and the PA are kind of enveloped or they're aggregated as well, because we're not going to be able to kind of come back and can consider these lower bounds. But, and so I think we're all like, looking to see that these bounding exercises do kind of include estimates that incorporate that margin of safety to account for the multiple sources of uncertainty that we've spoken about today. Okay.
Yeah.
Okay. Any other questions or comments before yes, Jim.
Yeah, hi. So I had a question. I know some of the other pollutants, when you do the area specific analysis, you look at multiple areas. Have you considered looking at more than one study area? And, this is, for the lead smelter, but maybe picking a second one that is around a regional airport where you might get some different results. And because, the same measurement around a regional airport, if it's ultrafine particles, is going to have a different effect than a lead smelter at larger particles. So had you considered maybe a second study area around a regional airport?
Yeah, so from the modeling tools we have, we'll not see a distinction like you are suggesting. If we're going to model just meeting the current standard, the model and the different tools that we have are not going to distinguish what the form of that air lead is. It's gonna process it all, and we don't have something that will process different particle sizes of lead differently. So we could do, the hypothetical generalized urban case study, you could envision when you look at those results, okay, that's near an airport where you've got a house right next to the idle area. You could envision it that way, or you could envision it that represents a neighborhood where the lead smelter is right next to somebody's backyard. It could be either thing. The calculation gets you an answer the same way.
Yeah,
it's a really simplistic way to say it. Sorry.
You're right, because the measurements doesn't distinguish, and the AirMod model doesn't distinguish particle size. So you're kind of stuck with one answer. Okay, that makes sense. Thank you.
Can I just interject that you can do that hypothetically? You can do that through your hybrid modeling as a what if scenario. What if it's all small particles? What if it's all large particles for the same air concentration?
The dust lead model takes different particle size, and I don't think
the parameterization of the model is dependent on particle size, and there's a bunch of discussion that we're working on in the REA for that choice. And there's some countervailing factors that are in play, but I think if we can run a sensitivity, what I'm hearing, and I think we were planning on this anyway, but I think there's a lot of value in thinking about particle size in relation to at least the dust modeling element, the hybrid dust model. I will say that this issue of particle size, penetration, deposition velocity, these things are very related, and then the data can be sparse and contradictory at times. And so, but I think hearing a request from you folks that the extent to which we can reflect in the bounding analysis, certainly on elements of the model, this treatment of different particle sizes, fractions makes sense if we can, and I think we're hearing that.
Okay. Any other comments before I turn it over to Ms. Barnes to add another additional supplemental clarifying statement? Susan.
Yeah, can I just follow up what Zach just said? So does that mean that you have different models for the lead particle, lead relationship based on particle size?
It wouldn't be blood lead, it would be, so particle size is a factor in parameterizing the dust model. So, how you get ambient air indoors and how it loads indoor
So the
dust. So that's the
deposition.
part.
Yeah.
Yes, exactly. And I don't want to overpromise, mainly because there's these things again, and this is just emphasizing the point that was made by the panel. It's a complicated model. Parameterization is challenging. Getting it together in a way that makes sense and seems reasonable as sort of a representative model is challenging. When you start pushing the model towards different particle size distributions or looking, I think we can look at that from a bounding analysis. We can put that in our coming out of this kind of discussion in IM. I'm not sure what that means when we start looking at the input data and how they hold together for different particle sizes. That's my point.
So you don't have the blood lead piece. Yeah.
Doors were open, doors were closed. How much particles of different nighttime, daytime? Some of the studies were there were ORD studies from years ago that we're using for some of these parameterizations. Pretty challenging. But we can definitely have this question of particle size and see what we can do on the bounding analysis for the dust, at least.
For the dust part, yeah.
And minimally, we've heard loud and clear to
I've
make
heard
sure
that,
we
yes.
characterize the issue
Yes.
in the characterization.
Yeah. Thank you.
Ms. Barnes, please.
Thank you for letting me come in a second time. While I was listening to this discussion, I looked up on the EPA NEI for 2017 lead emissions in Hennepin County. That's the county where Minnesota is located. Minneapolis is located. And it shows that the top 3 sources of lead in that county are airports. Number 1 is Flying Cloud Airport, 395 pounds of lead in 2017. Number 2 is Minneapolis St. Paul with 239 pounds of lead. And number 3 is Crystal Airport in Minneapolis, 234 pounds of lead. I was completely unable to find any smelters listed. There's 261 sources of lead listed for Hennepin County. I did not see any smelters. In the 4th place was Smith Foundry at 71 pounds and Prospect Foundry at 22 pounds in 5th place. The remaining 256 sources of lead in that county each emitted less than 15 pounds annually. So my question would be, where do I find the lead emissions released by these smelters? Another thing I do want to point out too is these aircraft are not stationary sources that, if you have a chance to look at Charlie Schlinger's submission, it does include a touch and go pattern where you often have pilots flying hundreds of times a day at some of these airports within a 2 to 4 mile radius of the airport at very low altitudes, often below 1,000 feet. And it goes on day in and day out, especially in the summer months. So, that the lead from these airports is distributed over waterways, prime farmland, people's homes, neighborhoods, even 10, 15 miles from the airport. So just, would like to find out how much lead these smelters are emitting. And I'm wondering why they're not included in the EPA NEI database. So thank you.
Thank you. Anyone from EPA staff want to address Ms. Barnes' comment?
I'll just say we don't have the emissions folks here to talk about QA on the NEI. I mean, obviously the lead smelter is a large source of emissions because it's the one driving the air concentrations in that area.
The only other thing I'll add on the airport is, whether we think the modeling on AirMod near the run-up idling locations produces the highest ambient air lead levels, if there is data that, and I understand that there's that there's mass emissions of lead from aircraft around the airports. I hear that. I think my question would be, to what extent has dispersion modeling from airports been done to sort of show the impacts of circling aircraft versus that idle up location? And,
I'm sorry. I did want to point out that there are the run-up emissions, and the EPA has said that they're the biggest contributor to lead emissions at an individual airport. Nonetheless, those run-up emissions are not included in the EPA NEI. And so we don't really have the amount of lead emitted by airports is much higher than the NEI reflects. And this came up in the Reed-Hillview study, where when Dr. Zaran looked at fuel flowage fee data, he found that the lead emissions at Reed-Hillview were 500 pounds higher per year than what was recorded in the EPA. I think they disconnected me.
Yeah. Okay. Well, thank you for the comments. I wish we had folks from emissions from EPA on the call.
Okay.
Before we summarize and talk about next steps, any more comments from any of the panelists? Questions? Okay. Well, this was a lot. Thank you for allowing me to join you guys at this stage. Yeah, it's I think we did cover a lot of ground today, and I hope it was helpful for EPA staff as well. We're going to give the panel another couple weeks to, let's just say, 2 weeks to maybe revise your individual comments, and those comments will be submitted to the administrator. Again, we're not looking for consensus since it's just a consultation, but I will submit them to the administrator as feedback as part of this consultation process. I don't think that there's anything else we need to do right now, Aaron.
Nope, I think that's it. I'll follow up in the email regarding next steps, but I think Jeremy outlined it. We'll give you an opportunity to revise the preliminary comments that you had submitted, and we'll compile that and we will send that on to the administrator. Then we'll wait to hear back from EPA regarding when their policy assessment is ready for the panel's review.
Okay. Thank you, guys. And I'm sure we'll be getting an update soon about maybe a revised timetable for the other stages of this process. Hopefully, we'll still be able to continue to meet as a panel in the future. But yeah, and I guess with that, have a good
question.
Yeah.
Yeah. Just a quick question. Do we have even a rough idea of when we might be engaged again in this process, like plus or minus 2 months or 3 months, like summer, late spring, fall, any sense?
So I'll take the opportunity to first thank you all.
Thank you,
Zach
guys.
and I very much appreciate the robust conversation and all the expertise that you all have applied to something which in many cases is a bit beyond what you do every day. So we really appreciate that. We're hoping to come back to you with the draft PA and the REA next year in probably the spring timeframe. That's the best I can say at the moment, as you've given us a lot to think about. So you might imagine that there's some parameters there we can't nail down.
Yeah.
Thank you.
And thank you, Deidre and Zach, for allowing us to torture you. But
like a dissertation defense.
Yeah, but yeah, and as soon as we find out about the timetable, I think it's a good question, Chris. We're behind schedule for this pollutant, for this NACS process, but yeah, we'll see what happens. Have a good weekend and a good Thanksgiving, everybody. We'll speak to you soon.
Thanks, Jeremy.
Thank
Thank
you.
you.
Thank you so much.
Thanks, Jeremy.
Bye-bye. Bye-bye.